to know what we are going to implement, and later on we shall evaluate how we are going to implement this intervention. A special announcement to all the planners present here. We have tried to invite all the planners. We have an ongoing assessment. It is an assessment of the different district planning departments. As the country program, the government of Uganda, Unfpa, 9th country program, has a strategy to improve the data and management section. So we are requesting that you take keen interest, that you have filled a questionnaire. It's a district planning unit assessment questionnaire. It has quite a number of details on capacity, the gaps, and the training needs that we need to have so that we can improve our data, population data dynamics, and availability of data. Dear our distinguished guests, as we begin our program, we hope everyone has registered because it's a key item on this agenda to make sure that we all live happy. Second item on our agenda is having an opening prayer. I would like to request, kindly request that we can maybe have a volunteer to have our opening prayer. As the agenda is flashed in front of us, we can have an opening prayer, then we have self-introductions as we warm up to begin our workshop and or meeting. We can have a volunteer to lead us in prayers. In the morning opening prayer, it's a blessing. Yes, we have a representative. Yeah. Thank you very much.
If you don't mind, you can stand up and we pray. God the Father, the creator of heavens and the earth and the owner of our life, we want to thank you for our respective roles and responsibilities. Thank you for the generosities you granted to us. And thank you that we are here to discuss important issues related to planning for service delivery to the people of Uganda, and particularly in our region. As we begin, we pray that you begin with us, and we pray you quicken up the feet of they that are joining us soon. We pray that you lead us all through, bless us as we are here, give us wisdom, knowledge, and understanding that we may deliberate on behalf of your people. And hereafter, when we pray that you grant us mercies. We pray all this believing and thanking you in the name of Jesus Christ our Lord. Amen.
A great hand of applause. Thank you very much for that very wonderful prayer. The next item on our agenda is having self-introduction and get to know each other, and we move on well. I would request to begin myself. Third time, let me introduce myself. My name is Joshua Kwebiha. I'm the acting senior national program officer, taking on the roles. I work with the monitoring and evaluation department at the National Population Council. It's a pleasure to meet you in this first of its kind workshop. Thank you very much.
Good morning. My name is Juliet Kwabaho. I work with Unfpa, the Kampala office, supporting the M&E function.
Thank you very much. I am Richard Wambi, the Deputy Chief Administrative Officer of the Great District of Adjumani, for Grandfield Omonda, the Chief Administrative Officer. Thank you.
Good morning, everyone. I am John Odaga. I am the Program Specialist for Monitoring and Evaluation, Unfpa.
Good morning. My name is Jimmy Ali, Assistant Chief Administrative Officer, representing CAO, Arua. Thank you.
And what are my names? District Community Development Officer, Arua District Local Government.
Good morning, ladies and gentlemen. All protocol observed. I'm called a Chancellor, District Planner Omaro, acting.
District Planner Jumani, Moini Fred.
Good morning. My name is Data Edward, Senior Planner Koboko.
Good morning. Ireku Zozumbaya, Planner Moyo.
Yes, good morning, colleagues. My name is Alex Chono, Unfpa West Nile Region Program Coordinator.
Rongum Moses, Principal
representing Kao Koboko.
Joyce Lanyero is my name, District Education Officer, Muro.
Good morning, my name is Joshua Thembo. I work for Naguru Teenage Information and Health Center. It's an NGO, and I serve as the BCC Advocacy Manager.
Yellow Tom is my name for DH2K.
Morning, my name is Jen Atai, District CDO Koboko.
District CDO Moyo, Kanyama David.
Morning, Edison Tumsher. My name's DHO Isinjuro.
Good morning. My name is Alan Agawa. I work with Unfpa in the Monitoring and Evaluation Department. Thank you.
Morning, everyone. My name is Camilla Buch von Schröder. I'm Program Coordination and Delivery Specialist.
Thank you. Good morning. My name is Moyao Chula Lamo.
Good morning. I'm Kola Monejime, Anna Lamo District Local Government.
Good morning, ladies and gentlemen. My name is Naves Gloria Mary, a research assistant from the National Population Council.
Good morning, ladies and gentlemen. My name is Kola George, standing in for the manager, ILA Plus Project, Brakanda. Thank you.
Morning, ladies and gentlemen. Daniel Emasit is my name. I work with Plan International. Thank you.
Patrick Okello, I work with Plan.
Samson Oyo, District Planner, Amuru.
Good morning. Boniface Opio, Planner, Nebi.
District Planner, Gago District. My name is Bogomin Richard Akal.
My name is Lagu Samuel, Chief Administrative Officer, Gulo.
Good morning once again. I'm Dr. Kilo Henry Oto, DHO Kitgum.
Kilama Christopher, District Planner, Kitgum.
Morning, Robert Mutumba is my name. I work with the Ministry of Health in the Reproductive and Child Health Department as a Principal Medical Officer.
Good morning, everybody. I'm called Apofia Mgoye. I work with Ministry of Gender, Labor and Social Development as a Senior Gender Officer, but also I'm here in the capacity of the GOU UNFPA Country Program. Thank you.
Yes, good morning, everyone. James Okello is my name. I work with Outbox.
Good morning, ladies and gentlemen. Faustin Twesi Jebagume is my name, District Planner, Chikuve. Thank you.
I would request to skip the front.
Good morning, everyone. My name is Maisha Godfrey, Planner Madiokolo.
Good morning. My name is Onega Kirshan Moses, District CDO Madiokolo.
Good morning. My name is Dr. Drav Caesar, in charge Rhino Cam Health Center 4, in charge Health Sub-District, and representing DHO Madiokolo.
Good morning. I am Eugene Sylvester, DCDO Otuka District.
Samuel, the District CDO.
Good morning. Simon Amanti, Assistant DHO MCH for DHO Terego.
My name is Kuyoshin Pascal Manano for DCDO Nebi.
Good morning. I'm Dr. Kwairo Justin, the acting DHO Nebi.
Yes, good morning, ladies and gentlemen. Rashid Yaoya is my name, a senior planner at Chiriandongo District.
Achola Jacqueline for DCDO Chiriandongo District Local Government.
Dr. Mutiaba Imam, DHO Kiriandongo.
Kabu Harriet, nursing officer representing a DHO Kamwenge District.
Morning, colleagues. I'm Bakesi Patrick, District Planner Kamwenge.
Good morning, Rosa Mullen is my name. I work with Care International.
I'm the cow of Agago, Muonge Abdunur.
Lulu Henry Leko is my name. I am the Assistant District Health Officer, Maternal and Child Health at Germany, stepping in for Dr. Drametu Dominic, the DHO at Germany District. Thank you.
Moadi Ramadan is my name. I'm the District CDO at Germany.
Good morning, ladies and gentlemen. I'm Dr. Rebecca Chivumbi Mayanja. I work with the Interreligious Council of Uganda as Manager Reproductive Health and HIV. I'm here to represent Interreligious Council as one of the implementing partners.
I am Modeba Nicholas, the District Officer, Zombo.
My name is Wanok Patrick, statistician for Planner Zombo.
I'm Gabriel Ola. This is Joaga.
Good morning, everybody. I'm Saturday Jackson, Senior Planner Kanungu.
DHO Pade, Dr. Yo Benson is my name. Thank you.
I'm Festo Kidi, DCDO Pade.
For Planner.
Good morning, everybody. I'm called Mama De Kasule, Minister of Education and Sports.
Good morning. I'm Dr. Chris Bondebujo.
Etil Tom is my name, District Planner Otuke.
Good morning. My name is Sharon Vusia. I work for Save the Children as a program.
Thank you very much, our distinguished guests, for the introductions. In a special way, I would like to request our leaders to take up their front seats, and we can have, because the next item on our agenda is the opening remarks. And also, as they move to the front seat, in a special way, I would like to remind the planners again, because this is a two-in-one activity. We are conducting an assessment of district planning departments as part of strategies to improve the data management section of the country program. Please, our dear planners, endeavor to make sure that you fill the questionnaire that is at the reception as we are registering. It will give us key information to be able to support the different planning departments, the data section. Thank you very much. Also, I would like to, we are holding our workshop in Gulu. I would like to invite our cow from Gulu district. You're most welcome, sir. Thank you very much for taking on your seat. With nothing much to add on, I would like to hand over the microphone to our dear invitees, the ones who have convened this meeting, to take on the opening remarks. Thank you very much.
Good morning, everybody. Pleasure to be back to Gulu and to see all the districts and implementing partners represented. Let me start by introducing myself. My name is Daniel Alamu. I'm the Deputy Representative for Unfpa Uganda based in Kampala. Let me start by recognizing my colleagues here at the high table. Mr. Samuel, the Director of M&E at the NPC. Mr. Samuel again, the cow of Gulu. District chairpersons here present, chief administrative officers, directors, heads of departments, representatives of central government ministries, and I take note we have the Ministry of Health, Ministry of Education, and Ministry of Gender, representatives of our implementing partners, representatives of civil society organizations, ladies and gentlemen, all protocols observed. Let me first of all welcome you all to this very important meeting, which is the district planning meeting for northern Acholi sub-region, West Nile, Southwest, and Central regions. It's really a pleasure to see all of you here today. Let me also thank our host district for hosting us in this beautiful district. Thank you, Mr. Samuel, for hosting us. Are ready well ahead in their planning and implementation. So are the IPs, the implementing partners, and so are we. And so by that point, it's quite difficult for us to change course where needed and to optimize our programmatic synergies and our ability to more effectively coordinate the implementation of the programs. So this year, in consultation, of course, with the NPC, we decided to take a slightly different approach. So we thought, let's actually have two engagements with the districts and the implementing partners. We have at the beginning of the year an annual planning meeting. And this is the second one we're having. We had one last month covering Karamoja and the eastern region. And now we're having a second planning meeting, as I mentioned, covering the Acholi sub-region, West Nile, Southwest, and Central. And that hopefully will give us all the opportunity to ensure that we're able to more effectively coordinate the implementation of our work plans, programs, and will effectively, and that's, I believe, the main objective, put the district authorities in the driver's seat, which is, I think, a feedback we have taken quite seriously from previous engagements. So one of the things I would like to highlight here, that given where we are now, I feel this is really an opportune time for us to come together and have this discussion. As you know, we have surpassed the midpoint of the Sustainable Development Goals and Agenda 2030 that is due in 2030. We are also fast approaching the goals that we set in the ICPD at 25 during the Nairobi summit. As you recall, the International Conference on Population and Development took place in Cairo in '94. That's where the world decided to put sexual and reproductive health as front and center of sustainable development. 25 years later, in 2019, November 2019, we had a meeting in Nairobi. I was there, and I was very delighted, of course, to hear His Excellency the President reaffirming Uganda's commitment to the ICPD agenda, as well as the 3 transformative results, which I hope you've heard about. But this is essentially reaching by 2030 0 preventable maternal deaths, 0 unmet need for family planning, and 0 SGBV and harmful practices. And we just had a meeting in New York last week, which the NPC represented us in preparation now for the ICPD at 30 taking place next year also New York. At the national level, we are also at the midpoint, or we've surpassed also the midpoint of the NDP3. And I, pardon me, I understand that the government has already completed a midterm review of the NDP3. We hope maybe to hear a bit about that in the course of the day from the NPC. We've also reached the midpoint of our country, Government of Uganda and UNFPA country program document that comes to conclusion in 2025. And of course, at the UN level, we're also at the midpoint of the United Nations Sustainable Development Cooperation Framework. So all this is just to say that we are at a very opportune time to come together and really assess jointly where we are, what have we achieved, and how we can improve on the remainder of the country program period, the 9th country program. As you would recall, in 2022, when we met in October in Entebbe, we had identified a number of areas where we said that, I hope everybody's okay there, where we said we wanted to improve and strengthen our joint delivery and coordination. These included areas related to increased access to quality integrated SRH services, both by looking at demand creation, which remains, of course, still a weak area across the board, and also ways to scale up high impact interventions, particularly in areas where we have seen that we have sufficient lessons to build on and to scale up, as mentioned, those if you want, success areas of work. The second, I think, big part that we discussed, and perhaps we haven't fully still appreciated how we go about it, is the whole rollout of the parish development model. I think we've all agreed that it's an excellent opportunity to alleviate, of course, poverty and create wealth at the household level in line with the government's vision. But how do we actually use now this model to accelerate progress on the outcome areas that we have identified in our country program, right? So, and also on sexual and reproductive health results. So I think that will be an important area that only you, I think, district officials could help us better grasp and appreciate. And we understand that funding is already being channeled to districts to help roll out and implement the parish development model. The third area or block of areas that we sort of also looked at, just as a way to remind ourselves, was really to look at how we can improve financing for our agenda and for promoting integrated sexual and reproductive health services and information. And again, the PDM could be one way, but not only. How can we optimize the available resources coming both from government and non-government sources? And finally, also issues related to evidence-based planning, availability of data, working with district planners and statistical committees, which is, I think, one area that we have set aside some time later in the day today to discuss with you. So we have, of course, following that meeting in October, analyzed all the priority areas that came up, which was a very tall list of priorities, I must say. And we use that to inform the formulation of our 2023 annual work plans. So today is an opportunity really to see whether we've hit the mark or whether there are still areas that remain uncovered by the work that we did. So you will hear, of course, from first of all us as UNFPA to give you a snapshot of where we have, what are the gaps that we have identified, and then we will hear from our implementing partners in that sense, you know, on the 2023 work plans, and that could hopefully inform a meaningful discussion around these areas. Maybe just to conclude and say that my hope and wish truly is for us to have a frank discussion and exchange around the challenges and opportunities that we have in this part of Uganda. So it will be extremely important to hear your frank opinions, your views on how can we really accelerate progress. Have we really doing things the right way, or is there, of course, room for improvement? There's always room for improvement. We've heard district officials in the past complaining about insufficient coordination, about funding not coming directly to them. And I think we have responded in part, at least to the second issue. We said that, including last year in Entebbe, that this is not something, of course, we can do as UNFPA. We can't really transfer funding directly to the districts because of the high transaction costs. So the essential modus operandi that we have chosen together with the NPC is really to work through the central government ministries and implementing partners. However, when it comes to coordination, which is really a valid concern and point, we said, let's see how we can ensure that district authorities, again, remain in the lead and in a better position to coordinate. And henceforth also this meeting today to allow these district authorities to appreciate what's taking place in their district and to help guide and inform our planning and implementation in the court. Of course, that particular documentary about, I think it's called Uganda's Stolen Innocence, does not tell us anything new, but I think it just helps highlight again the type of challenges that we're facing really in the country when it comes to teenage pregnancy and other sexual reproductive health related challenges. So we need really to work together and see how can we resolve all these different challenges and how can we ensure that we're able to build a country that is really able to fulfill the potential of all our boys and girls in the country. So finally, let me just thank also all of you who are here. I think without you, of course, we wouldn't really be able to embark on this journey together and move the needle on many of these indicators. So I really want to thank all the district, local government who are present here today, all our implementing partners, and all of our stakeholders who are with us. Really, we have to work together, as I said, to see how we can expedite our work and our results really for the betterment of life for all boys and girls and adolescents in the country. This is an expression, of course, of our mutual commitment to support the implementation of the program, and we trust that by ensuring open and frank discussions here today, we can really continue, as I said, our work and journey together for a more sustainable Uganda. Again, thank you, Mr. Chairperson Kao of Gulu for hosting us, and thanks a lot to the NPC, our close ally and partner, and thank you all. Thank you.
Thank you so much, Mr. Alemo Daniel. Ladies and gentlemen, let me start by introducing myself. My name is Samuel Samson Omwa. I work with National Population Council as the Director in charge of monitoring and evaluation. Just to make the opening remarks, and I would like to start by appreciating and recognizing the high table, the UNFPA deputy representative. We have to note, however, that the country program was resilient and adapted effectively to the COVID-19 situation, and we brought on board innovation, especially in ICT. And we embraced this in order for us to implement our activities. As you are all aware, the economy has reopened, and this gives us opportunity to implement our intervention and achieve the goals and targets we set. As the deputy representative mentioned, the currently we are implementing the third National Development Plan, which has undergone a midterm review, one owing to what we have already alluded to in terms of the COVID-19 and the need to realign the budget. The midterm review, I'm glad to inform you that was undertaken, and it's in line with the findings that the first budget called circular for the next financial year and the other we are implementing took into account the key reprioritization that the government made in order to revitalize the economy and then for us to implement the interventions that we envisage to achieve. Ladies and gentlemen, effective and efficient delivery of the 9th country program requires strategic partnership with a broad range of stakeholders, both at national and sub-national levels, such as ministries, departments and agencies and local government. And in particular, our partners, the civil society organization, cultural and religious institutions, the private sector, media, academia, and the beneficiaries for inclusive program delivery. It's in light of this that the National Population Council, together with UNFPA, has organized this 2023 Workplan Regional Dissemination meeting. This is the second in a cluster of 2 that we have organized. As already alluded to by the deputy representative, we held one in Morocco, and this is the last one we are holding. And it's in response to the issues that were raised during the annual work planning and review meeting. And in particular for this, we want to engage you, the district leadership, and we want to address this issue of saying the implementing partners sneak into a district without your knowledge. So the purpose of this dissemination meeting is to bring all of us on board in terms of what interventions we are going to implement, how we are going to implement those interventions, and how are we going to report on those. We believe that if we work as a team, then we should be able to achieve the goals and missions that we have articulated in the 2023 work plan. As you may all be aware, this meeting specifically, we want to share with you the 2023 program priorities for the district from the approved 2023 work plan. We also want you to interface more with the implementing partners and then also our colleagues from the Ministry of Education, Health, and Gender as our key delivery actors. We want also to have a candid discussions on the interventions that we have proposed and to ensure that there is effective coordination in the implementation of the 2023 work plans. Therefore, as we implement our 2023 work plan, I need to emphasize that we need to focus on strengthening our capacities for human resources and systems to enhance our delivery at all levels. We already know that the government flagship service delivery point has been defined as the parish. How do we leverage on this parish development model to ensure that we implement our interventions in line with the government aspirations? We also want you to enhance your knowledge and management, and especially in terms of building a data bank to inform evidence-based planning, implementation, and decision-making at all levels. Above all, we also want to influence positive mindset change and human capital development in communities to ensure there is sustainable livelihoods. I need not to emphasize the need for us to strengthen our coordination and implementation of the country program. And of course, we all know that the National Population Council takes the lead in population and data systems. And we all know that this year we are planning to conduct the 2023, the National Population and Housing Census. I know the mapping exercise has been ongoing and in some other places has been completed. So we hope you also take into account the key issues that we need to have in place for us to have a successful census. I would also want to announce that in this year, the World Population Day celebration, we shall be hosting it in Leptong district on 11th July. And as is the tradition from National Population Council, we always engage the entire sub-region that is hosting the national population, the World Population Day. So we shall be engaging more with the districts, all the districts in the Lango sub-region. Distinguished participants, the National Population Council reiterates its commitment to continue providing leadership and coordination of the government of Uganda, Unfpa 9th Country Program. This is in line with our principal mandate to coordinate the country population policy and program. We commit to ensure that the coordination structures of the country program is fully functional. The steering and technical committees will provide the required support to ensure that the country program achieves its goals. Finally, ladies and gentlemen, I would like in a special way to thank our dear partners, UNFPA, for their continuous support, both financial and technical, towards implementation of the government of Uganda, UNFPA 9th Country Population Program. In particular, especially for the Acholi sub-region and West Nile, we need to appreciate the development by the Netherlands Embassy, especially for the support they gave to the ANSWER program. In the same vein, I also want to thank our implementing partners who are here. You do a credible job in terms of making that last mile delivery. I also like to, in a special way, thank our partners, the Ministry of Health, Ministry of Education, and Ministry of Gender, Labor, and Social Development for the leadership you undertake under your various outcome areas. The civil society organizations for the support you give us, and most importantly, the local governments. We all know the decentralization policy we operate in, and the Local Government Act is very clear. The service delivery point is at the local government. So the chief administrative officers, your heads of departments, the district planner, the district community development officers, district education officers, district health officers, we appreciate your efforts in terms of making sure that we address the population issues of this country. I would wish you success in the deliberation and pray that in this meeting, disseminating the work plan, we achieve the actions or the aspirations that we envisage. I thank you all for listening to me and wish you a fruitful deliberation for God and my country. Thank you. The coordinator assembled us here and abandoned us, so I will take that role. Ladies and gentlemen, permit me at this point to welcome our dear host, the Chief Administrative Officer of Gulu District, to welcome us here and make his opening remark and declare this workshop open. Thank you, sir.
The Deputy Country Director, UNFPA, my namesake Samuel from NPC, the district chairpersons that are available, my colleagues, the chief administrative officers, the district planners, the district health officers, the team, the respective ministries of education, gender and labor, gender, colleagues from the development partners, distinguished colleagues from the civil service fraternity, ladies and gentlemen, good morning. On behalf of the Chief Administrative Officer's Office, Gulu, allow me take this opportunity to warmly welcome you to Gulu for this very important workshop. You are most welcome. Gulu has been your home, dear Deputy Country Representative, and I must also use this same opportunity to again welcome you back to your home. So you are most welcome home. Distinguished ladies and gentlemen, I'm going to make my remarks, but of course my remark will be a summation from the two remarks. The two distinguished guests have actually addressed us. Apparently I may not have a lot, but out of their submission, I'm going to make summation, and as leaders, I will implore us to take it very seriously. First and foremost, I want to re-echo and assure UNFPA and NPC about the commitment of the district leadership to this program. We are committed and we shall eternally be committed. Two, I want to assure you that you've requested for frank discussion, but I will add that we are going to not only make frank discussion, but we'll make sincere and open discussions in the course of the workshop. So those are the commitments and assurance that I felt I should make it known. Distinguished ladies and gentlemen, as a country, we are privileged to have partners like UNFPA. UNFPA's intervention is very critical given the state in which we are. So as leaders at local government levels, let us seize this opportunity with both hands, and we ensure that we deliver. This program, the 9th country program, has not only come timely, but it has come at a time when we needed it most. Millennium Development Goals and so many other interventions that government has come up with and committed itself to. But I can assure you that the Paris development model is the best is the best development model that we have as a country. So as leaders, we need to take advantage of this model. But as a country, again, I want to inform us as leaders that I think we are not taking this Paris development model seriously. We are not giving it the serious attention that it deserves. As a country, the focus seems to be more on one of the pillars, which is the financial inclusion aspect, which to me, well, it's okay, but unfortunately may not be the best area where we should really be able to interest ourselves most. The pillars are structured, the model is structured into 7 pillars. And when you look at other pillars, to me, as leaders, we should be concentrating more on those pillars than the financial inclusion aspect. We have pillars like the information management system, the mindset, production, and etc. So as leaders, I implore you that we give more attention to those other pillars than the financial inclusion pillars if we are to succeed in improving service delivery in our country. Relatedly, my namesake also talked about the decentralization policy. Yes, Uganda is being governed under the decentralized governance system. We have the best structures, we have the best enabling policies, but as a practitioner, as a scholar of decentralization, I see a gap, and this gap is in respect to the planning units. The planning units at the local government or at the districts are supposed to be the fulcrum or the engine of decentralization. But from my observation, keen observation actually, you realize that the planning units are incapacitated. So out of such programs, we'll request that due attention is given to our planning units so that they can be able to, further the wishes and aspirations that are vision in the decentralized governance. Relatedly, it goes without saying that we are a poor country. Poverty amidst us is overwhelming. And the leaders, let us wake up to that reality. Reports have just come out. The national population, the poverty report has just come. And the data, fortunately most of you are data experts. The reports are quite disturbing, particularly for the northern region. They are quite disturbing. Poverty level seems to be on the rise in spite of all the government efforts of government and other partners. So as leaders, let us wake up to the reality. Poverty per se is very bad. When we are in a poverty, that is when doors to all endeavors can be closed. All what we are doing can be erased in amidst wallowing poverty. My brother, the deputy country rep. World Bank regards poverty as a situation where we are below $1. From my keen observation, I have been emphasizing and telling people that for us in Uganda, poverty is like an elephant. When an elephant appears, it is noticeable. You can be able to see that this is an elephant. Likewise, the poverty that we have is noticeable. And as leaders, as partners, we really need to wake up to the reality. Let us have meaning out of our positions. Fortunately, we have commitments, serious commitments from government, from the international communities, from even the population. So let us try as much as possible to make meaning out of our leadership positions. Let us try to support the government aspirations, the aspirations of the donors, the aspirations of the global bodies. Finally, I want to thank you so much for the attendance. I want to thank UNFPA, NPC, for inviting us for this very important workshop. I'm meant to understand that it's the first of its kind. We give credit to you for this workshop. In the same breath, I will also implore you, since we are for a regional work plan dissemination meeting, I will implore you to ensure that at an appropriate time, we also have a workshop for implementation review meeting, so that we see where from the work plans, where we have moved, whether there are deviations, whether we are making progress, so that we can be able to chart the way forward and ensure that the gaps are also addressed. This is a humble request. Colleagues, this is a very important workshop. I may not have a lot to submit. I invite you to be very committed, to be very attentive, and at an appropriate time, I'll also request that the issues that we've discussed here should be discussed at your respective local governments. You know, a lot of resources and time has been committed for this cause. So in turn, let us be able to be courteous enough to inform our team that we've left behind, so that the issues that we've discussed here can have that reflection, a country reflection, a local government reflection, a district reflection. So with this, I want to thank you so much and use this singular opportunity now to officially open the workshop. The workshop is open. Thank you so much. Yes, program director, you were lost.
I was watching from behind.
Yeah, you take up from there.
Yes, I would like to request our distinguished guests at least to give a very big round of applause to our delegate at front desk. Yes, thank you very much, our dear heads, for that comprehensive opening remarks. Dear colleagues, we have, as you realize, we are both physical and online, like how our director had aired it out, that we have members on Zoom. And I would request the IT team to give them an opportunity to introduce themselves before we go into the dear members online. It's your time. Please come in and introduce.
Good morning, Mr. Wakomiza. I work with UNFPA in Arua.
Good morning. My name is Ray Vutsere. I work with UNFPA in Yumbe.
Good morning, ladies and gentlemen. My name is Immaculate. I work with UNFPA in Germany.
Good morning, ladies and gentlemen. My name is Cyprian Anyi. I work with UNFPA in Arua. Thank you.
Good morning, colleagues. My name is Wilberforce Mugwanya. Going to be based in Gulu. I'm the program coordinator for Gulu under Juman. Thank you.
Good morning, colleagues. I'm called Judy Erongot. I'm based in Moyo. Currently, I'm in Obongi. Thank you. Over to you.
Yes, you're most welcome to the workshop, the online team. And we have noticed that we also have members that came in quite late.
We can't hear you. We can see you speak, but you seem muted from the...
The IT team, the IT team, the IT team, the IT team, the IT team.
Thank you, you're back.
Okay.
We can hear you now.
We have members who came in a little bit late. I don't know, we give them a very short time to introduce themselves and then we proceed to our agenda. Probably an update on the agenda. We are requesting that we can have the objectives, methods, and expected deliverables on the agenda as the next item. Then the presentation by UNFPA on district priorities will come after the break tea. This presentation is connected to the IP presentations. It will give us the flow and the logical outcome. We shall comprehensively understand that presentation as we come in straight after break tea. We request we have that edit on the agenda. Members who have come in a little bit late or who came in after the introductions, we would like to give you a minimum of 5 minutes just to introduce yourselves as we come in with object opening. You can give us your...
Yeah, thank you. I would like to apologize for coming late. My name is Ojo Zubairi, acting DHO Yumbe.
Thank you. Good morning. Rashid Khalil Azawa is my name, the district planner Yombe.
Any other?
Good morning, ladies and gentlemen. Rangoli Santos, economist, Obonge.
Good morning, Lara Emmanuel, acting Kao Kirku.
Good morning, I am Omoin Peter, Senior Labor Officer Omoro for DCDO Omoro. Thank you.
Morning, I'm James Okelo Kidi, DCDO Kitcom.
Good morning, colleagues. I'm Okoda Russell Jurwa for DHO Marata District.
Good morning, I'm Alfred Gato, Senior Planner Maracha.
Colleagues, my name is Okot Samuel Obonyo, Assistant DHO Nwaya for the DHO. Thank you.
Good morning. Kinyara Ronald is my name, Planner, Nwaya District Local Government.
Thank you so much. Abubakar Samulonga is my name for DO Bongi. Thank you.
Paul Bishop Deleba from Arua.
Good morning, Millie Nashmuli. I'm a statistician and I'm a caretaking district planner, Arua District.
Yes, thank you very much for adhering to the short time we offered you. Again, my name is Joshua Kwebiha. I'm a national yes, one more, yes.
Monyae.
Yes, thank you very much. My duty today morning is not so much. I would like request the IT team to flash my presentation. Yes, my role is to present on the program. Let's give the team a time to. Yes, I'm to present on the objectives of the meeting, methodology, and expected deliverables as we begin and live during this place. So a brief introduction. This has been aired out that the government of Uganda and UNFPA developed the 9th country program document for the years of 2021 to 2025 program cycle. As you know, we have had a number of programs straight from the 6th country program, 7th, 8th, and 9th. This is the 9th, and so the 9th country program was endorsed by the government of Uganda on October 27th, 2020, during a high-level meeting chaired by the Minister of State for Foreign Affairs at that time. So the 9th country program was approved by the UNFPA Executive Board at the former annual session of executive boards for the UNDP, UNFPA, and UNOPS in New York. That was in 2021. So currently, there is a business plan that is being rationalized. This is where now we are running. We are rolling out a business plan. a number of key interventions were highlighted during that time and are still going on. Objectives of the meeting. So specifically, we are here to share the 2023 program priorities for the districts from the approved annual work plans for 2023, implementing partners' work plans and departments implementing the different programs. So specifically, as you remember, we had an annual review and annual work planning meeting that was in October at Entebbe. From this meeting, we came up with priorities that were also updated. We had, first of all, we had district consultative meetings that gave us a number of input priorities, which we later on re-aired during the annual review and annual work planning. These guided the development of work plans for this particular year. So our major objective, number one, is to come and share the outputs and what has been funded, then have a discussion on interventions to ensure effective coordination in the implementation of the 2023 work plans. As you remember, as aired in the annual review and annual work planning meeting, there was an issue of coordination. This is part of the strategies to have a time to scrutinize these different plans. We are the districts. Remember, we are here to guide the districts, the IPs in implementing. And then later on, we shall have an action plan, an agreement of how to do business this year so that we get the coordination role right from the very beginning to the end. I don't have much to say, but thank you very much for your audience. As we are requesting that we can move out for break tea and then come in and have a comprehensive presentation, beginning with priorities from UNFPA, and then later on the district IP work plans. Yes, Mr. Gava can also. Yes, there has been a small communication from the hotel. We need some more time to go for break tea. With those objectives and methodology and expected deliverables, I would like to request Mr. Gaba Alan from UNFPA to give us a presentation on the UNFPA 2023 district priorities. You're most welcome, Mr. Gaba. Thank you very much for your audience, our distinguished guests.
Okay, thank you. Yes, thank you, MC. My name is Alan Agaba once again. I would like to take this opportunity to welcome once again. I'll be sharing with you the consolidated snapshot of the 2023 priorities following the annual work planning process that we started in October last year. And as you know, was already been made aware, we started with the Karamoja region, and we shared these work plans in Karamoja. So this time we are going to be presenting the priorities that will be implemented in the 4 regions of Northern Uganda, West Nile, Southwest, and Central region. Okay. So the outline of my presentation, I will take you through the partnerships that we have to deliver the 2023 priorities, the different partners, and of course the geographical coverage of the work plans for 2023 within the 4 regions. Of course, we'll also allude to the development challenges underlying the investment that we are making in these regions. And of course, lastly, we'll share the district-specific intervention areas and budgets. Of course, my presentation will give a snapshot picture or global picture, and the IPs will follow with detailed IP-specific activities per district. Right, so first to look at the development challenges in the regions, in the 4 regions that we have today. As you realize, our main SRHR issues that we're addressing are around maternal health, GBV, and family planning. So if you look at the most recent statistics from UBOS, mainly the DHS, of course we don't have a new DHS, but this is a 2016 DHS. If you look at some of the maternal health indicators, you'll notice that the regions of West Nile, Acholi, and Toro, Bunyoro still have a high fertility rate above the national average of 5.4. I don't know if you can clearly see the maps, but I'll just quickly take you through. And like, you know, these are usual statistics which we are aware of. Modern contraceptive use is still far below the national average. And of course, the NDP3 target of 50% by 2025. You can see Acholi, West Nile having actually the lowest among the regions that are represented here. Of course, Karamoja has the very lowest, but since we don't have Karamoja here, you see West Nile modern contraceptive use is very low at 19%. I'm just highlighting a few. Same for, well, the rest are all still below the 50% that the NDP3 targets by 2025. The reason why we need to continue investing to address these development challenges. Maternal mortality, still high. From the most recent MPDSR report by Ministry of Health of 2022, you'll see quite a number of districts still above than having maternal deaths above 90 per 100,000 deliveries. And this is really spread all over the country. But for the regions that are here, you may want to pick interest. You see in the West Nile, I think Arua is still in red there. It's among those districts with greater than 90%. We have some patches of red. These are just the red patches you can see. If you know the map of Uganda, I'm sure you can easily identify how your district is performing. I'll not go through all, but this is just to give a background. GBV, oh well, not GBV yet, sorry, unmet need for family planning from the most recent DHS. West Nile, Acholi are still leading with the highest need, with the highest burden of unmet need, with of course West Nile leading at 43%. Teenage pregnancy, that's the graph on the extreme right. Again, we have most of the, actually generally all the regions apart from South Central Angola and so on, they are still above the national average of 25% teenage pregnancy. And remember the NDP3 target plan is to reduce teenage pregnancy to 10%, less than 10% by 2025. So we still have a lot of work to address the issues of teenage pregnancy. And if you look at the most recent statistics from HMIS, you'll notice, I don't know if this map is clear, the districts where you have the red dots, this is where we have, from the monitoring data, the highest burden, again, of teenage pregnancy. You can see there is a red belt from the east, Busia side, almost across through the north. Some districts in West Nile still have high rates, and of course, we have red dots also, a cluster of red dots on the western side of the district. So this is just to give the background on the development challenges that we're trying to address in line with the NDP3, SDGs, and also the Unfpa mandate. So I've talked about GBV already. You can see the districts with the red bars, I mean the regions, are the ones we have here. Lango, West Nile still have high levels of GBV from the most recent DHS of 2016. Hopefully things have changed with the implementation of interventions as we wait for the new DHS this year. And if you look at the most recent data from HMIS, the districts in red still mirror more or less the same regions which have the highest, which had the highest level of GBV in the last DHS. You can see literally over half of the country, of the districts in the country, are in red, meaning that they have a high level of GBV cases being reported. And this is only data from HMIS, which may actually leave out additional data from others, because not everyone reports to the facilities when they have a case of GBV. So this is just more of monitoring data to support the DHS, as we wait for the DHS. Right. So that's about the development challenges and why we are still intervening in these regions. I think that gives us a good background as to why we need to continue investing to address maternal health issues, family planning, and GBV. So for 2023, I'll start by first giving you a snapshot of our regional level investment in terms of interventions to address the issues that I've talked about earlier on. So the 4 regions that we have here, the northern region, we are going to be investing mainly in activities to ensure provision of sexual reproductive health services and access, maternal health, family planning, and of course, you know, I think, yeah, maternal health and family planning mainly. And then we're also going to also invest heavily in GBV prevention and response for the northern region. As I did earlier on alluded to the fact that GBV is also very high. We're also going to have substantial investment in interventions for the youth, adolescent sexual reproductive health, and of course strengthening data systems. West Nile, the biggest investment will go in interventions to ensure provision of high quality sexual reproductive health services and utilization, adolescents and youth, GBV, and population and data, as well as other interventions, of course, like coordination and strengthening community structures. So the northern region, the total budget for the northern region will be approximately $1.3 million for 2023. And this is just for the direct district activities, which will come through implementing partners. We also have national level interventions which are implemented by the MDAs, which may not be through direct IP. So the figures will even be higher. So West Nile region will take the biggest amount of resources, $3.5 million for 2023. And for those interventions that I already alluded to, so it's actually it's the region where we're investing with the most number of resources. For the reasons I've already, if you notice, West Nile actually still had the highest burden of the poor SRHR indicators. So it's not surprising, perhaps. Sorry. This thing moves very fast. Southwest region, we also have interventions there. Mainly in Southwest, we are going to be intervening in GBV prevention and response as our highest main investment in terms of interventions, and SRHR access, as well as adolescents and youth, and population and data. Central region, we have few interventions there in a few districts, but mainly they will be targeting GBV prevention, population and data, strengthening population and data systems, and adolescents and youth, and others as well. So in terms of the money investment, Southwest will take an estimated amount of $440,000, and then Central region will take the list at about 137, excluding national level interventions. These are more of the district direct activities that will come through the implementing partner work plans. So this is the regional picture. If you allow me to continue, I'll then go to the breakdown at district level. So each of the districts, what kind of interventions are we going to be supporting, and how much resources are we going to invest in 2023? Starting with the northern region, Gulu, our host district, we are going to be intervening mainly in GBV prevention, strengthening data systems, adolescents and youth, and we are going to be investing in about 22,000 US dollars through direct activities by IPs. Kitugum, the main investment is going to be strengthening provision and access of SRHR services and GBV response. And the total investment is actually much higher. We're going to be investing approximately 280,000 US dollars in Kitugum district for those interventions. I hope that district representatives are taking note, because after my presentation, the IPs now will tell you the details of what is in this, this package of activities. So again, in the northern region, Lamo, in investment, I'm going to be talking about the top two main intervention areas. Then the rest, of course, will give you the presentation. Lamo, we are going to be investing most of our resources in SRHR provision and access and GBV response to a tune of about 336,000 US dollars. If you do the math in terms of shillings, I think that's some bit of resources. Agago also has we have a significant investment of resources and interventions, mainly promoting SRHR access and adolescents and youth. So you can see there's a variation between districts on which interventions are leading in terms of emphasis, because of the difference, again, in the indicators of the different, or the variability in terms of the SRHR situation in those districts. Amuru, our biggest interventions will be promoting SRHR and access and adolescents and youth to a tune of about 219,000 US dollars in 2023. I'm talking about annual figures, only 2023. Noya, we have the least investment. We have few activities there, mainly GBV prevention and response with about 4,000 US dollars. And Apache also has few interventions in 2023, and they will mainly focus on population and data. And these are the district direct. There will be other national level interventions by NPA, NPC, and other MDAs that we have who are not implementing through other implementing partners. So this is just the minimum we are investing. Otuke, again, we're only responding to address GBV to a tune of about 46,000 US dollars. Padel, the biggest investment is going to GBV prevention and response to a tune of about 58,000 US dollars. I don't know if I'm moving very fast, if you are not able to pick the, am I moving very fast? You're picking the details of your specific districts. Okay. Omoro, we are going to be investing mainly in GBV prevention to a tune of about 46,000 US dollars. Okay. Now, Chiriandongo district, in our planning processes, we normally push it to the north, but we know it doesn't belong to the north in the other administrative classification, but forgive us for this. This is just more of the planning process. So we put it in terms of our internal management process, we put it towards the north. So the biggest investment or the main interventions would be in GBV response and provision of SRHR services to about 84,000 US dollars through IPs. Now, that's all with northern districts. There are 11 in total that we are working in. Of course, there are other districts which we are not going to be implementing activities in 2023 in the north. So it's not all the northern districts. Now, West Nile, which takes the biggest share of interventions. I'll start with Arua. The biggest package of interventions, or the main focus will be on ensuring provision of quality sexual reproductive health services and access, maternal health, family planning, and so on, adolescents and youth, and population and data systems. So Arua will take resources up to a tune of about 241,000 US dollars through IP activities. Yumbe, the main interventions in 2023 through our IPs will be addressing Yumbe. You notice Yumbe actually we have the leading interventions will be on adult and sexual reproductive health, and then provision of SRHR services, maternal health family planning, and then GBV prevention. And they will take a significant amount of the budget of about $424,000. Germany, the main set of interventions will be promoting adolescent sexual reproductive health and provision of SRHR services, and also take a significant amount of about $357,000 through IPs. Moyo, the main activities or interventions will be on strengthening adolescent sexual reproductive health and the provision of SRHR services, and of course GB prevention, to the tune of about $349,000. Koboko, the main interventions will be targeting to address or to improve provision and access of SRHR services and strengthening adolescents, youth, sexual reproductive health services to a tune of about $147,000. Zombo, the main interventions will be strengthening adolescent and youth sexual reproductive health services and provision of SRHR services to an estimated total of about $270,000. Madiokolo, perhaps taking the lion's share of all the West Nile districts, the main interventions will be focusing on strengthening provision of SRHR services and access, maternal health family planning, and so on, and also adolescents and youth, and GBV prevention and response, to a tune of, it's actually I think the highest, it's taking the highest amount of money. Surprisingly, yet I think it's one of the newest districts, not so? So taking about almost $449,000. Obongi, also a relatively new district. The main interventions will be to strengthen provision of SRHR services and access, maternal health, family planning, and then adolescents and youth, GBV response, of course, and the rest. To a tune of about $223,000 through IP activities. I'm still emphasizing that district direct activities from the IPs. NEBI, the main interventions will focus on strengthening adolescents and youth sexual reproductive health services, then provision of SRHR services and access to a total budget of about $291,000. Pakwach, the neighboring district, they are relatively new as well. The main interventions will focus on strengthening adolescents and youth sexual reproductive health services, and then provision of the other SRHR services and youth, maternal health family planning, fistula, and so on, to a tune of about $266,000 in 2023. Maracha, the main interventions will focus on strengthening provision of SRHR services and access, and the adolescent and youth sexual reproductive health services, to a tune of about $247,000. Terego, also relatively new. Main interventions by our IPs will focus on the provision of SRHR services and access, GBV prevention, and the adolescents and youth sexual reproductive health services, to a tune of about $341,000. That's it with the West Nile region districts. So allow me to go to Southwest. Southwest, we have Isingiro. The main focus of interventions in Southwest, in Isingiro, will be GBV prevention and response and provision of SRHR services to a tune of about $204,000. Kamwenge, the main interventions will be in GBV prevention and response, provision of SRHR services, and strengthening data systems for GBV and population to a tune of about 90,000 US dollars. So you'll notice that the Southwest, the district budgets are relatively smaller. Kasese, main interventions will go to addressing GBV and ensuring access to SRHR services and adolescents and youth services to a tune of about 20,000 US dollars. Chegegwa, I think this is where we have quite a number of interventions, mainly promoting access to SRHR services and GBV response, as well as adolescents and youth and population and data, to a tune of about 152,000 US dollars. Bundibujo, where we're also intervening, we are going to be mainly interventions will focus on addressing gender-based violence, adolescents and youth, sexual reproductive health, and then provision of the other general SRHR services to a tune of about 10,000 US dollars. Bushenyi, we are largely going to be investing in GBV prevention and response, and this is mainly through the Ministry of, through the GBV special court, because I think it has they have a court circuit which they run in Bushenyi, covering all the catchment districts around, districts around Bushenyi. So most of the resources will go to GBV prevention through the work of Ministry of Justice, through special GBV court sessions to a tune of about 46,000 US dollars. I'm almost finishing. Kanungu, we are going to be investing in strengthening population and data systems to a tune of about 4,000 US dollars. Mbarara, again, population and data system strengthening, same amount, 49,000 US dollars, and also Chikube, strengthening population and data systems, same level of investment. So the last one is the central region. I don't know if we have, I didn't hear people from the central in the introduction, hope you are there. But in central, we are in Kampala, Mubende, and I think Kayunga as well, and Rengo. So Kampala, we are going to be, the focus of our 2023 priorities will be on addressing GBV and response in Kampala, and of course strengthening adolescents and youth sexual reproductive health services to a tune of about 28,000 US dollars. Mubende, we are going to be, the interventions will focus on strengthening population and data systems, and then GBV response to a tune of about 10,000 US dollars. Lastly, Rengo, we are going to be strengthening, addressing GBV. I think this is through the Ministry of Justice and through the special GBV court sessions. I think there's a court circuit, I think High Court circuit, which sits in Rengo, support all the central districts. So there will be, so the resources may not only go to Rengo per se, but all the other districts which will be served by the Ministry of Justice to a tune of about 46,000. Kayunga, again, is also the same approach, GBV response through the special GBV court sessions through the Ministry of Justice and Constitutional Affairs to a tune of about 46,000. And lastly, Wakiso also. Wakiso are strengthening population and data systems. And these are issues with supporting the UDHS process and, of course, GBV data systems as well to a tune of about 4,000 US dollars. So that ends my presentation, and I hope the energy levels were still up since they had already announced tea before I came in. But that's the summary of the priorities, a snapshot of the priorities at regional level and district level. So I don't know, MC, if the IPs are following this one immediately after me, because the plan was that the IPs also now go in to give us exactly what are they doing in each of these districts in terms of specific activities, the details. So MC, you can guide me.
Yes. Thank you very much, Mr. Agaba, for that detailed presentation. As consensus, I think we can have 10 minutes of break tea. Okay. Yes, the population is big. Let's have around 20 minutes of break tea. We are going to move down to the big tent with the big reception dining with a grass thatched, well-designed place. A special announcement as we move out, please make sure that the district planners to submit your assessment tools to the reception, as well as the IPs, please make sure you submit your 7 minutes presentation to the IT desk behind. Thank you very much. There will be a team guarding your ICT if we all move out at the same time. Thank you very much. Nice break tea. For the safety of our equipment, we request that we all move out together and then come back at a go for easier safekeeping.
Karamoja, Acholi, and Lango up to West Nile. That's a red belt. Then some districts in the west, southwest. Of course, as you know, the districts are very many. The names could not fit on the map. We have 146 districts now, something like that. So the names could not easily fit on the map, but in total there are 56. So that's what I wanted to clarify. As the IPs are coming on, I don't know who is coming first. Is it, I think IRCU had sent their presentation. I think we shall go in the order in which the IPs are sending the presentations. We already have from IRCU, Naguru, and Plan International. So I think we'll follow that order. And the rest we've not received presentations. Kindly, Ivan, I hope you flashed the email addresses where they can send the presentations. So let's start with those three. And the rest, please send. Maximum 7 minutes per IP, or even less. So let's start with IRSU then. Thank you.
Sorry, I think Nagulu Teenage presentation is ready. You can take the floor. And then later on we shall follow with IRC, and then the rest we shall be calling. I think we shall have reactions after all the IPs have done the presentations, their respective presentations. Thank you.
Is it still morning? Okay, great. Yes, thank you again for the opportunity. My name is Joshua Thembo, and I will be sharing with us what Naguru Teenage Information and Health Center is going to be doing in the region. We are a new IP, but we are glad that we are learning and already doing a lot of work in Acholi and the other regions. So the activities we are going to be delivering this year, specifically for Acholi, they are not so many, and they are around radio programming, so I'll be flashing them quickly. I've told Agaba, I've asked him whether 3 minutes is also okay. He said fine. Okay. Where is the laptop that we're using? Okay, next slide, sir. Yes, so Naguru Teenage Center is a national NGO, and our mandate is around sexual reproductive health and rights programming, and our beneficiary audience, our target beneficiary are the young people, and we have been working around this for over 27, now coming to close to 30 years, supporting and working closely with the government to ensure that young people access services in a youth-friendly manner. We have been in areas of health system strengthening, advocacy, social behavior change, communication, research, ICT, and also inclusion. So our business has mainly centered around there. And of course, not forgetting service provision, especially for the young people. So we have been key in setting up youth-friendly corners, model centers that we have used to inform programming and even government, especially Ministry of Health, on the issues of providing services to young people in a youth-friendly manner. Most of you are aware of this. I won't go into detail of what we have done and achieved through that. But that was just mainly to talk about what we do. Next slide, sir. Next slide, quickly. Yes, so we, like I said earlier, we are going to mainly deliver radio programs in Acholi sub-region. And we shall be delivering 3 activities. One is around amplifying voices of communities and beneficiaries for improved community mobilization. And here, of course, we are looking at GBV prevention and SRHR promotion. So we shall be working with community leaders, young people especially, amplifying their voices through radio programs. And in Acholi, we are going to work in Omoro district, Kitgum. We have Otuke district in Lango sub-region. The rest are in Karamoja. We are also going to support mass media activities for awareness creation. Mass media here again, we are looking at radio, but also we are also using the new media. And we are ready again into radio programming, still for the same districts. Actually, Omoro, Kitgum, and Lango, we are looking at Otuke. The rest is in Karamoja. So second activity is mainly looking at advocacy for GBV prevention and SRHR. So under second activity, we shall be engaging the duty bearers, the district leaders, and the other opinion leaders. So the first one is looking at amplifying community voices, having the young people come on radio, having parents and caretakers have their voices amplified through radio. The second activity, we shall then engage the duty bearers, the technical people from districts, and all the other opinion leaders. And the third activity definitely will be monitoring and supervision, which we are hoping to do with the districts. And here we shall be sharing lessons and trying to use it to inform our programming. We shall work with the districts and evaluate, see how much are radios impacting or influencing behavior and also influencing change and also helping us to address GBV and promoting SRHR. So this is what we are going to be doing for the rest of this year in Lango and Acholi sub-region. So we are already into MOU signing. Because some of these districts are new, we are already into MOU signing. For some of them, where we have not yet completed, we have already engaged, and others we are starting on the process. We have already conducted a mapping exercise for the radios, and some of them were recommended by the districts. Some, of course, we picked from the Live Your Dream campaign that we had last year. And some of the radios are already mentioned there. We have Mega FM is in Gulu, but it is broadcasting for the other districts. Great, I've got a red flag. Is it red or orange? 1 minute left. So I think that is it. These are the radios we are going to be working with to deliver the talk shows. Yes, I think we shall stop at this slide because my time is up. Thank you very much. The rest are more of the results and what, but I think it's not necessary for the meeting. Thank you very much for listening. I think we shall have an interaction at a later time.
IRC? Interreligious Council.
Good morning, ladies and gentlemen. Can someone project my presentation, please? My name is Dr. Rebecca Chivumbi Mayanja, Manager Reproductive Health and HIV Services at Interreligious Council. Please, next slide, please. That is the order of our presentation. Yes, just a background about Interreligious Council of Uganda. It is an indigenous faith-based organization that has been in existence to at least more than 20 years. And we work we unite all religions, we work with them, faith-based organizations. Mainly at the moment, we work with the Roman Catholic Church, the Protestant Church, the Orthodox Church, the Muslim Supreme Council, SDA Church, the Born Again Faith, Alliance Pentecostal and Evangelical, that is APE, and we also work with the Baptist Church of Uganda. And these 7 member organizations, that's where we base our implementations of all activities. And we work with them in all the regions, that is Karamoja, West Nile, Acholi, Bukedi, Sebei, Western, Southwest, and Central region. And our priority areas are leadership, capacity building, strengthening systems to integrate sexual reproductive health, HIV, GBV, messages, and routine activities. Next slide. So that is what we set out to do in 2023. And as I said, we work through our member organizations in those generally in the regions. There are some activities where we do, when it is all regions, with IRCU does the implementation, but we also have, we sub-grant to the different member organizations to carry out the activities. And one of our activities facilitate regional level quarterly interfaith coordination meetings in the generally in all the regions, but since we are in Acholi, in this region, and that one is done by IRCU, and the leaders that we select are from dioceses, Muslim districts, SDFUs, and deaneries. Then we have joint stakeholder consultation on challenges of adolescents and young people, including sexuality. That one, IRCU does it directly. Then we have activities that are implemented by our member organization, such as organizing religious and cultural leaders dialogues on ending violence against women and girls. Then we also organize community dialogues with particular focus on father-daughter pairs to prevent and respond to GBV in the target communities. We organize community dialogues in GBV preventive behavior involving survivors, and create demand for sexual reproductive health services using commonly agreed messages at IRCU. So those activities, generally, the member organizations organize dialogues, meetings, activities with the congregations. Next slide, please. And we also organize general community dialogues. So most of our implementation is through dialogues with the congregations, and we also build capacity for the religious leaders to generally pass on all the messages to the congregations. We do advocacy and social behavior change communication, and we do community mobilization through routine congregational work and other innovative approaches. The next slide, please. So far what we've done in Q1, we organized the religious and cultural leaders dialogue in West Nile, and that one 62 religious leaders attended, and we expect them to go down and also pass on the messages to their congregations and communities. Then we also organized and carried out intergenerational dialogues where the elders in the communities and the young were able to meet in one room and discuss matters to do with sexual reproductive health. That one we were able to create, generally, to bond parents and young people so that they freely communicate with their children concerning those matters. The last slide, please. Those are some of the activities, those are the photos when we had the meetings. The last slide, please. So what are the challenges? The challenges, IRC is to receive UNFP funds Some activities we've not been able to carry out because we've not yet received funding. We only received funding so far for UDC 62, and that's what we've been able to implement. Then also, there is limited engagement of senior religious leaders by the many partners, especially the district and the regions. So we request the districts to engage our religious leaders because they are key in changing this world. And also we expect, we request the leaders, the district leaders, to generally support all IRCU activities to move them forward for sustainability purposes. I thank you so much for listening.
Yes, thank you very much for your presentation from IRCU. Next on our presentation agenda is we want to have Action Aid Uganda to come in and make their presentation. To keep it short, to 5 minutes, like the previous presenters. Action Aid. Okay, let's you're ready? Yes, you're welcome. Take the podium.
Thank you very much. Good morning, colleagues. I think the IT person will be helping me to move to the next slide. Okay. So, as ActionAid, we are implementing this project in the northern region for the first time, though we have implemented in other regions like the eastern region. But since this discussion touches the northern region, we shall concentrate on the districts of Omoro, Otuke, and Kitgum. ActionAid Uganda belongs to the ActionAid Global Federation of 40 countries. And in Uganda, it's registered as a national NGO. And we are doing work around women access to justice, climate resilience, and governance. We operate in the regions of Karamoja, Teso, West Nile, and northern Uganda. So the interventions we are doing in this area, we are supporting training GBV focal point persons, health workers, police, majorly the actors in the GBV referral pathway in the districts of Omoro, Otuke, and Kitgum. But we have not been able to implement an activity as of yet, following the challenges we shall highlight. And these are new districts. At the moment, we are in a process of signing MOUs with them, as we also handle what is missing on the side of UNFPA. Support delivery of essential safety and protection services at the GBV shelters. In this region, there's only one shelter being funded under this program, and that is the Gulu GBV shelter, and its operations are on. That's where I currently sit with the psychosocial support officers. So we also envisage doing strengthening multi-sectoral service delivery for quality integrated SRH services and essential GBV services, still in the same districts, Otuke, Kitgum, and Omoro. So these are new project areas we've not been implementing there, and the explanation follows the earlier one. Is it not moving forward? Okay. Training and mentorship, health workers, on SGBV management, the filling of the police form 3. It needs technical training. In my knowledge in doing this work, previous as a legal officer, you would find some of the medical workers would just shed the diagram that has the private part of a woman, and unable to classify whether the wounds are day old, whether there's a rupture of the hymen, whether they found any foreign fluids in the genitals of the survivor, and as such that would deeply affect the investigations, the evidence they get, and also the securing a conviction. So these are systematic challenges that have been existing, which we are going to address still in the same districts. We have not implemented that. Support quarterly integrated service delivery outreaches in hard-to-reach areas. We've also not yet implemented that. It's going to be implemented in the same districts. Sustain community technology-based distribution of contraceptives. That's also yet to be implemented. Support CSOs to facilitate survivors of sexual abuses and sexual services. That's also yet to be implemented. Strengthen data management, information systems, and promote data collection. That is ongoing. It's something we do all the time on a daily basis, so it's just a continuous thing under the project. Awareness on the rule of law, human rights, and integrated services. Maybe let me explain item 6.8, how it is ongoing. Wow. Let me explain that. It's ongoing in that currently we're operating at the Gulu GBV shelter, which receives survivors from the parts of Lango and Greater Nacholi. So as such, all the data captured is entered in the NGBV database and our MIS systems. Progress of the activities. Activities touching integrated services at the GBV shelter, what has been implemented, and other activities have not been implemented. Some challenges relate to the bureaucracies in disbursement of funds and the fact that these are new project areas that are being navigated. Okay. Thank you for listening. So I work as a coordinator of this project at ActionAid, Uganda. Thank you. I'm Kevin Wanjala Oma.
Thank you very much, Kevin, for that precise presentation. Next on the agenda, we would like to invite Plan International to make their presentation and make it quite snappy. We have running short of time. You're welcome.
I presume it's afternoon. Good afternoon. I'm making presentation on behalf of Plan International Uganda. My name is Patrick Okello. My name is Patrick Okello. I'm the team leader for Answer Project in Plan. These are some of the activities that we implemented with in-school young person in the 7 districts of West Nile. The first one, they're making, boys are supporting us to make reusable sanitary pads, and here they're in for a live sale session. Proceed. Proceed. At Plan International Uganda, we have been around since 1992, and our programs in the country are being guided by the 5 years country strategic plan, which runs from 2023 to 2027. And we are contributing in 2 major areas in terms of youth economic empowerment, quality and inclusion in education, both primary and nursery, then strengthening child protection system, adolescent sexual reproductive health, and also looking at school-based water and sanitation, hygiene. Then also we look at gender, civil society strengthening, and disaster risk reduction as a cross-cutting issues. Then we are present in those regions, and our offices are in Adjumani for humanitarian response, Kamuli, Lira, Nebi, and also in Yumbe for development. At plan under Unfpa Government of Uganda country programs, we are contributing to ANSWER program, and for annual work plan 2023, our budget is $1,144,759 US. In terms of that, we have two donors. Our sister organization in Finland, Finland National Office, is contributing $238 US for operation. Then fund for UNFPA are $909 US are directed to interventions to the communities. And we contribute to the outcome one with those outputs. Then also we contribute to output two. Next slide. Output two, we look at strengthen multidisciplinary leadership for improved implementation and accountability towards the demographic dividends roadmap by 2023. And we have two output areas, that's enhance implementation and accountability towards DD priorities at district level, then also enhance implementation and accountability toward DD priorities, and also targeting district level. So we have two outcomes under that. This is a high level. I may not go into the activity. However, I shared this with already district planner as our off-budget contributions. Next. Again, in terms of activities, we have activities in engaging cultural leaders to pilot intergenerational dialogues in the selected districts. Here we are piloting under 5 districts in West Nile, and also in 10 sub-counties. The 5 districts are Nebi, Pakwach, Zombo, Adjumani, and Moyo. Then we are also, under that, we are supporting the religious leaders at district level to disseminate pastoral letters in the 7 districts, and also in the 79 sub-counties. Then we are supporting a community platform to deliver an integrated community mobilization and gender transformative approach to individuals, families, and also in communities. We are using this under SAS approach, under male engagement, then also under positive parenting session. Again, here in 79 districts, and also 7 districts in West Nile. Proceed. Then we also support the district leadership and the sub-county leaders to provide support supervision to the community structures that we're working with. And again, in all the 7 districts and 79 sub-counties. Then we're also promoting positive parenting using the model parents groups in the 79 districts. And under sexuality education, we are supporting teachers to provide sexuality education using the PNC school approach in 287 schools in the 79 districts, but also supporting peer educators to deliver sexual reproductive health information and livelihood through VSLA in the 79 sub-counties. Proceed. Then we are also supporting district to have the coordination meetings at sub-county level, and also facilitating the dialogues that can result into successful participation of youth in government programs, again in the 79 district, and 79 sub-counties and 7 districts. This is an area where we're engaging the district planner to train youth into terms of government planning and budgeting processes, so that we have voices of young person in that. Then we're having the multi-sectoral coordination meeting that brings together the district stakeholders to discuss issues that concern young person in their district. Yes? We may skip this. These are the activities that we have delivered in Q1, but we're going to share this with the district for your reference. Let's move to the next slide. Next slide. Okay. In terms of progress, looking at changes that we are able to observe in the community, we have learned that religious leaders and council leaders now continue to offer counseling and mediation to families and integrated health education messages on managing family sizes, prevention of gender-based violence. Again, here we have seen now they are increasingly putting the communication around sexual reproductive health, GBV, in their daily sermons, which is a good practice. We have also seen that the community knowledge and attitude towards the power balance in terms of reproductive health has a little change. This we measure using the rapid assessment that we did recently in the 7 districts compared to what was last year by Unfpa. But also, we have also learned specifically in some districts that the knowledge on modern contraceptives has probably improved when we look at the CAP survey, which was conducted last year, and also the SASA assessment, which we conducted this year. The knowledge has increased, but seeking service is still a challenge. We learned that youth still have a challenge in terms of seeking the services. Last slide, second part. These are the challenges that I've almost talked about, but also just to emphasize that when homosexuality bill was passed by Parliament in the community, it a little bit shifted the conversations. The young person, the community started discussing more in terms of what the bill is talking about, the impact of homosexuality, and leaving some of the critical issues around teenage pregnancy, GBV, even in their sessions, it shifted somehow the conversation. But we continue to use the approved manual by the ministry in terms of engaging them, which is improving, bringing back the conversation into the critical issues in the community. And thank you so much. The recommendation we can share is down there. Thanks, and over to you.
Thank you very much for that quick presentation. Next on the agenda, I would like to invite Outbox to come and make their presentation.
Yes, good afternoon, everyone. James Okello is my name. I work with Box. So that's the flow of our presentation. So Outbox is an entrepreneurship support organization. It's an entrepreneurship innovation support organization that works with young people and the business community. So under this program, underway program, we have an initiative called Up Accelerate. So Up Accelerate is more of an innovation incubator that supports young people to develop and implement breakthrough entrepreneurial solutions. So these solutions, we look at young people coming up with innovative ideas or solutions that can help address issues to do with gender-based violence and making sure that there is access to sexual reproductive health and rights. So, you know, when we talk of SRHR, it has a lot of components. So we look at young people coming up with innovative ideas, which we ideate from the grassroots until those ideas grow and become a reality to be able to solve the identified challenges within their community. The overall outcome of this is to enhance utilization of sexual reproductive health and rights and GBV services among the women and young people in northern Uganda, including refugees, in order to realize their right to live health and reproductive lives. So this is how the program works. We identify challenge areas. We launch call for applications. We do select. After the selections, these teams pitch. After pitching, we select the most innovative ideas or solutions, which after we incubate, after incubation, they become market ready and be able to solve the identified challenges within the communities. So after the selection and all that, so that's how the process moves: learning labs, mentorship, and execution. So still, that's how the program works. These young people identify the problems faced through inspirations, ideation. So the ideation is where they do different experimentations within their communities to try to understand more about the challenges within their community, such that they can be able to build the proof of their concepts to make their solutions become market ready. This quarter, the activities that we've planned to do is cohort 1 and 2 businesses supported to foster intellectual growth and skills development through mentorship linkages to ensure that there is increased engagements between innovators and district stakeholders to further build their solutions. So the program is in the 2 regions of West Nile and Acholi sub-region with the selected districts. So in Acholi sub-region, we're operating in 4 districts, that is Kitgum, Lamu, Agago, and Amoro. Then in West Nile, we're in 6 districts, that is Moyo, Ajumani, Mariokolo, Arua, and Yumbe. Then we also want to identify 6 most promising businesses to receive follow-on financial and technical support. So in the last years when the program was launched, so far we have 2 cohorts. So the 2 cohorts, we've got 17 teams. So after these teams utilizing all the 18 millions, we want to select more 6 businesses. We want to select 6 businesses out of the 17 businesses, such that we can add more money for them to scale up. So far, so the progress now, the 17 businesses that we selected, we've been able to move with them a journey whereby we've been able to formalize these teams, formalization of the teams to form legal entities, since they are more of business teams. So we registered them with URSB, opened for them bank accounts through which they can be able to receive their funds and be able to implement their solutions. Then training and technical support, those are the activities that we've been able to do with them, introduce them to human-centered design as an approach that can be used to build social change innovations in reproductive health and rights. We also supported them to define their community target audience by understanding the problem statement and test the assumptions around the desirability. Then supported social innovations and community-led ecosystems by empowering founders to take on leadership roles in shaping their home communities as agents of social change. Then we've been able to support them financially. Like I said, we don't only give them technical support, but for them, innovation is something that is somehow expensive. So there is no way how they can ideate and make their solutions become market ready without financial assistance. So every team is entitled to receive up to a tune of 18 million Ugandan shillings. So these funds are always disbursed in tranches to ensure that there is proper utilization of these funds, proper accountability for them to achieve the intended goals. So for now, I've been able to disburse funds up to 80% for most of these teams. Still on progress, we've been able to work with over 40 stakeholders engaged to support the innovators. These include mentors, advisory panel, and former participants, both at local and national level. I've been able to work with over 30 local governments, district leaders. Our reach is across the 9 districts in Acholi and West Nile. Over 1,200 community members reached through engagement in product solution development. So this one we've been able to reach out to this through, because these young people, they work with they work with community members in terms of like trying to do their different experimentations to understand more about their community. These are the lessons learned. There's a need to strengthen partnerships and collaborations as a key factor for success, continuous engagement and information sharing about social innovations with all the stakeholders, then capacity building for social innovation mentors. Then challenges, there is a limited engagement of local mentors in terms of offering support to social innovators. We are operating on a limited budget with a lot of expectations from the District of Operations. Limited key players in the innovations ecosystem, and this has always been a challenge because some of the stakeholders don't really understand the nature of our work and how we do execute our work. Sometimes we've also had challenges to do with supporting teams virtually. Then there is also limited capacity for some teams to scale up. Much as we've tried to work with these teams, some of them it's hard to bring them on board and be able to scale up to the next step because some of them, they still lack a repeatable business model. So with that, I beg to stop from here. Oh, thank you.
Thank you very much for the presentation from Outbox. Maybe a reminder, we can have the comments written down, then we have one plenary session for all reactions. Next on the agenda, we would request CARE International to come and make their presentation. Thank you.
Good afternoon. This is from CARE International. That is the outline for the presentation. At the core, we work to ensure women and girls experience greater gender equality and live lives free from violence and realize their sexual and reproductive rights. It's part of thematic areas in our country program where we're looking at 3 different thematic areas around gender justice, around climate justice and livelihood, growth. We contribute to output 1, 2, and outcome 2 of output 2.1 within the program for WAY. And our key models working with through the school clubs. We work with mentors. We have SASA as part of our implementation methodologies. We support YSLAs. We support women and girls leadership and mentorship, and also work with role models. In terms of our key interventions for this year, this is the no-cost extension, and the areas that we are working around is mentorship for teachers. It's a continuing activities for 11 districts, and we are looking at 56 schools in each of the districts. While we are referring to the 8 districts, those are the mother districts, but we are also taking into consideration the new administrative units that makes it 11 districts. So we have Lamo, Kitgoma, Moro, Agago, Ajumani, Moyo, Bongi, Yumbe, Arua, Madiokolo, and Terego. And we cover 103 sub-counties. We also do mentorship training for patrons and matrons on masculinities and men and boys. This was one of the key issues that was raised the last time, the conspicuously absent involvement of young boys, and that is one of the things that we took on to address. We also support and monitor schools to roll out plans, and that is going to be in the 5 refugee hosting districts, so it is not across all the 11 districts. We are supporting and monitoring schools to roll out work plans for SRH and GBV information sharing, targeting school clubs. We're looking at the 103 sub-counties in each of the 11 districts, and we're targeting approximately 56 schools in each of the targeted districts. We're looking at strengthening menstrual hygiene management and making of reusable sanitary pads, and this is specific for the refugee hosting districts. We're providing ongoing mentoring support for women in safe spaces. Again, this is going to be very targeted for the 5 refugee hosting districts. We're looking at also continuing to support the volunteers in the safe spaces and conducting integrated monitoring and support supervision for those spaces. We are going to be looking at supporting and facilitating also the mentors to reach out to mentees, young girls and women, and that is especially on issues around leadership and on girls' leadership, and also addressing issues around sexual reproductive health rights, and also looking at gender-based violence programming. We're looking at mentoring young girls and providing income-generating activities for mentors and mentees in selected districts, providing support supervision to these mentorship structures, and we're looking at working with around 1,176 women in total across the 11 districts. We're looking at supporting existing girls with the young people's youth and lively groups, and also providing the required mentorship for them and their supervision, as we also support small grants to these youth groups as we build the level of groups to be able to work within their context. We're looking at organizing and supporting learning circles, especially targeting farmer groups. We've had partnership supporting Nuri farmer groups, and in these ones we look at how do we integrate SRH into the work that they are also doing, and then we do the mentorship for SASA activists for all the 11 districts. We're looking at scaling up the engaging men and boys approach, and this will be in the refugee hosting districts, the learning circles, and engaging men to look at how we are going to be supporting young boys in their locations. Being the last year of implementation, we'll also be looking at how do we thank the volunteers that have been working with us for this period of time. In terms of progress, we've had a number of activities we've implemented in the first quarter. I'll not go into all of that, but we have already started the work, cognizant of the fact that we have this quarter and second quarter, and then we'll be scaling down on our implementation. So it's work already ongoing. In terms of the lessons learned, we are looking at linkages that are very important for group growth. And of course, that also takes into consideration the other programs that are happening around PDM, UWEP, and the others. And we have been learned that most of the districts where they take an interest in linking these VSLA groups and to the different opportunities, the growth is higher. There's a lot that we are learning from the diversification and growth within the work that we are doing. We start up as VSLA groups, but a lot of these get into other livelihood engagements, and we've got examples of this within the groups. Of course, there are also those that have not taken off, and also they've that is where you'll get reported vandalism of the centers, the demand for remuneration, oversight, is poor and the activities are few. We've also noticed that continuous engagement with the technical personnel in the districts, the midwives, the focal points has enabled better dissemination of our work. The challenges, of course, we've got the issues around transfer, routine transfer of teachers, the struggle with safety and security, the safe spaces, the limited opportunities to earn income, the negative cultural norms, and of course, we are scaling down increasingly. So those are some of our findings, and we have those recommendations. Okay, thank you.
Thank you very much. We are requesting Save the Child to come and make their presentation. Save the Children, sorry. Save the Children to come and make their presentation. Save the Children International. That was a check as well. You're most welcome. Thank you. It is Save the Children. Thank you.
Good afternoon. Save the Children, indeed. My name is Sharon Busia. I support the M&E function for the answer program within Save the Children. So, under Save the Children, within the answer program, we work in 8 districts, as stipulated there. We have 5 in West Nile and 3 districts in the north, that's Muru, Agago, and Lamu. Then Maracha, Arua, Terego, Koboko, and Obonge for West Nile. Okay, so I'll go straight to the background because all of us have been having a look at the outline of the presentation. So who are we? My NP friend, please pay attention. So we are the world's leading independent organization for focusing on championing children's rights and interests, putting the vulnerable children first because they deserve better. So we are working in over 116 countries with the response to major emergencies, innovation development programs, and ensuring that children's voices are heard. So our vision is to ensure that in the world, every child attains the right to survival, protection, development, and participation. The mission is to inspire breakthrough in the way the world treats children and to achieve immediate and lasting change. So we move to our ambition for 2030, focusing on the 3 areas of survival, learn, and be protected. So under survival of children, we are focusing on ensuring that no child dies from preventable causes before their 5th birthday. For learn, all children learn from equitable, quality, basic education. So for being protected, violence against children is no longer tolerated. We have our core values stipulated there as well: ambition, creativity, collaboration, integrity, and accountability. So we move to the key areas of intervention. We are implementing the PRC approach, that is for sexuality education, for upper primary and lower secondary, for adolescents and young people in the districts of Agago, Lamo, and Amuru. However, as I mentioned earlier, we are also working in West Nile in the 5 districts. Earlier on, I made this presentation for the north, but I was informed that I was supposed to include the one for West Nile. Regardless, we proceed. There is a peer education approach. This focuses on reaching the in and out of school young people with SRH information through the peer educators. So we are also both in West Nile and in the north. We have the SASA approach for community mobilization to prevent GBV. Then we also do the VSLA approach, support to village saving groups of young people and accessing SRH GBV prevention information. So how do we integrate VSLA and SRH? We have peer educators who have sessions with the VSLM members as well as the CBTs. After the peer educators, after the CBTs have had sessions on financial literacy with the VSLM members on a weekly basis, the peer educators also schedule and they have information relating to SRH and GBV. So we have positive parenting model approach aimed at empowering parents of adolescents with positive parenting skills to raise responsible children. Then engaging religious and cultural leaders to foster positive gender norms and beliefs that promote positive behavior of young people. Dialogue meetings on SRH and GBV, then interdimensional dialogues with cultural leaders. So I'll proceed. The Excel there just, it's showing a distribution of sub-counties per district and where the intervention lie. So our progress on implementation has been, or is being presented per indicator on how we've been performing. However, I would not really go into the details of the nitty-gritties. We have that presentation and I believe all of us will be able to access it to be able to save time. And we have quite a number. We are working with around 31 indicators, and we managed to achieve on at least 80% of the indicators in terms of being able to have a reach. So that is how we are progressing for the indicators. They are quite many, but we'll have a look at the performance if we follow the presentation. So we are implementing output 1.4, whereby committee members empowered to transform negative gender and social norms, thus reduce GBV, teenage pregnancy, and child marriage. So under that output, we had quite a number of activities. One was the dialogue meetings with young people by religious leaders. And then we also had public meetings in the 5 districts. We conducted check-in meetings with the SASA activists as preparatory activities for the support phase that we are implementing now. Thank you. I'm being told I have 1 minute, so I'll progress to the other output. We had a one-day planning meeting under output 1.5. We had quarterly mentorship support supervision meetings. Then output 2.1, enhanced implementation and accountability towards DD priorities at the national level. So those are the key challenges that we are having. We could have I just want to highlight one. Some districts have big and many sub-counties for support supervision. Thus we find ourselves not reaching all the stakeholders or the community structures we are working with. And this can be, or we are trying to work upon this through the joint support supervision with the district stakeholders. Thank you.
Yes, thank you very much. Save the Children. We have BRAC coming in with their presentation. Please take up the podium.
Good afternoon, ladies and gentlemen. By the name Samamwan Jo. I'm standing in here for BRAC Uganda. BRAC Uganda, we are in the districts of Acholi and West Nile, specifically. In Acholi, we are in Gulu. We are in Pade. And also we are scaling up to Kitgum and Omoro in the near future, beginning this June. But also in West Nile, we are in Yumbe and Terego, then also part of Chiriandongo, which we normally consider it under West Nile. But also, I've been made to understand that this meeting is also taking care of the Western. So in Western Uganda, we are also in Kasese and Chegegwa as well. So that's basically where we are working. But also outside the two regions, we are also in Karamoja and Eastern and Northeastern. So that's basically where we are working. Thank you. BRAC Uganda, we are implementing a project called ILA. ILA is Empowerment and Livelihood for Adolescents. The project started in 2016, and it is designed to provide social empowerment and protection to adolescent girls and boys who are basically from poor families, and seeing that they are empowered to overcome social barriers and become social agents of change in their families and communities. Like I said before, the project is all over the country, in most of the districts, in northern Uganda, east and northeastern, West Nile and western Uganda. The following are some of the key interventions for 2023. We plan to have male action group formation to enable us eliminate GBV in communities. And this will be in Chiriandongo, Yumbe, Kasese, Chegegwa, and Terego. And not forgetting other districts that I made mention, Kasese, Chegegwa, among others. So here we do this through the male champion. We have the male champion who take lead in enabling that the male action groups are formed. And they have sessions with the MAG. And the MAG also do have a one-on-one sport activities with the boys in the community to ensure that the message is escalated. Secondly, we have the parents meeting on positive parenting and GBV, prevention and response. We see that the parents' capacity are being built to ensure that they're able to respond to GBV cases and also to support, especially in reporting, so that the survivors are accorded support. This is supposed to be done in Chiriandongo, the mentioned district, Yumbe, Kasese, Chegegwa, and Terego. And those are the sub-counties where we are working. It is unfortunate that the sub-counties in Chegegwa and Kasese has not been reflected, because I just learned of this from here, that we're supposed to have all these other regions represented here. We also plan this year to have in-school awareness on menstruation, teenage pregnancy, and HIV/AIDS. And this we do through technical staff from the facilities who are always contracted to go and train the adolescents in school so that they get the messages. And also the adolescents in school are expected to be able to talk to, escalate the messages to their peers. Those are the districts where we are going to conduct the activity in Chiriandongo, Yumbe, Kasese, Chegegwa, and Terego. And those are the sub-counties where we intend to have the activities conducted. SRH club-based session and monitoring of the graduated clubs. Under SRH club-based sessions, we normally have series of activities. We have topics, series of topics on SRH, like family planning. We have growth and development, and series of topics that are always conducted by the mentors. And also beside that, we have other life skill training. We have dramas and all that. So it is actually done through the mentors, one of the community structures under ILA Plus project. This is supposed to be done in Kiriandongo, Yumbe, and Kasese, and Chegegwa, and of course Terego. Livelihood training and VSL activities is expected to be done this year. This is actually done through identifying some of the club trades. The participants are engaged to identify some of the club trades of their interests, and they're supported through a skill artisan or facilitators to ensure that they acquire the relevant skills. And of course, the VSL activities, they are also trained on VSLA, and saving is done. Saving and loaning is done to ensure that they get money to do some small business that will enable them meet some of the basics. This is supposed to be done in Chiriandongo, Yumbe, Kasese, then Chegegwa, among other districts. Also this year, we intend to have a scale-up of the project of the ILA model in new project areas. Basically, this year we are targeting Otuke, Kitgum, and Omoro. We are yet to have a meeting, inception meeting with the respective district leaders And also we shall be able to be assigned the sub-counties where the project will be implemented. Safe space construction for adolescents, girls and boys. We will be able to do this in all the districts where we are working. And we are looking at piloting with 2 safe space per district. But of course, we have all the safe space in all these other clubs. But this is the one which is going to be constructed by ILA, under the project. But also we have community spaces where we have identified. And also we also have houses within the community where our adolescent girls and boys do meet, so that the activities are not interfered. Identification of model parents to support greater awareness on GBV, domestic violence, FGM. Like made mention before, we do community parents meeting and we build the capacity of the parents. After building the capacity, we do identify, out of the parents that we've built the capacity, we do identify some of the exceptional parents supposed to take lead in creating this awareness and supporting other parents on those biases. Support the youth in production of reusable sanitary pads. This is one of the key activities that we intend to do this year. And this is done, we do train the adolescents to make their own, but not the disposable, because we realize that it is better for them to make something that they can use, and when it is done, they can still make it. So this is supposed to take place this year, and the process has already started. We have already started procuring the materials, and we hope to have it done this year, this financial year. Progress on implementation for the first quarter. We have had 500 participants. With those statistics, with those disaggregation, reached during the parents' meeting, the different parents' meeting conducted in Terego, Yumbe, on positive parenting, preventions, and response to GBV. And these parents, we have seen them having family meetings. They've asked the staff on the ground to go and make follow-up and talk to their children. They've asked community structures to also support where need be. And so we have seen that this works. This is helping, especially the parents, to be able to handle some of the queer behaviors among the adolescents within the community. I've been told that I'm almost time up. I think we have, maybe just a second. We have 1,014 pupils during the in-school awareness on menstruation, teenage pregnancy, and HIV/AIDS in the districts of Yumbe and Terego. We have also had 18 male champions participated in the review and reflection meeting. Like my colleague said before, I believe that this presentation will be shared, and we shall be able to go through this presentation one by one. Lesson learned, synergies and linkages created with other partners and government institutions has helped the project. Local initiatives like community contribution in terms of providing local materials and community spaces, that's also helped us in especially achieving the sustainability of some of the activities that we are conducting. Utilization of the existing community resource persons like VHT, which is one of the community structures under ILA Plus, has contributed a lot, something that has helped us maintain our presence. Our challenges we have had in and out of the district movement by the mentors and the participants that has affected some of the activities, although this is being worked on, especially in the settlement, the refugee hosting districts. We have had overwhelming needs by adolescents versus a limited resource envelope. But of course, this is being done. We are getting over this through linkages and referrals, linkages and synergies rather. The other challenge is also negative cultural practices that perpetuate GBV and male patronages. I think this has been spoken by the previous presenter. I don't want to expand on that. And then the recommendation is that we should have a timely release of funds to avoid delayed activity implementation. Then also we recommend that we should be able to have joint biannual or quarterly project monitoring to strengthen the implementation among partners. Thank you.
Thank you very much for your presentation. Ladies and gentlemen, we have one more presentation from LWF. I don't know if they're ready. Not yet. As part of our usual icebreakers, we are requesting we have a short icebreaker. We request everyone at least to stand up shortly and we stretch a little bit as we await that presentation coming in. You know, we try to stretch a little bit and as part of, it has been a long day and a marathon. So we can stretch a bit, like 1 minute. Yes, thank you very much. Now we can take our seats again. Now, in a special way, we would like to, as LWF prepares to come, in a special way, we would like to welcome the Kao Arua district. The next session we are going is a plenary discussion and we'll come up with an action plan as a way forward. We would like to request our Kao from Arua district, Mr. Ali, to come and take the front seat as we begin discussions. I believe all of us have been taking notes, specifically on the district allocations, and then later the packages. I know we have a lot of questions, and this is the platform created to have this discussion so that we can begin at a good page, and later on, in around October, when we meet again, we can review what we agreed upon during this time. Thank you very much. Let me hand over. Yes, sir.
Thank you. Maybe just to take a couple of minutes while LWF is preparing for their presentation, I just wanted to emphasize 3 points ahead of the discussion, so that when the district representatives are contributing, they can also sort of speak to these points. And also, of course, the implementing partners when they react later on. The first point, I think, that personally I would like to hear a little bit more on, with all this information and set of interventions shared, how do we see multi-sectoral coordination going forward? Is it working well in your respective districts? I mean, we know that you have had challenges. I think it will be helpful to appreciate whether you feel there's been some level of improvement, and if not, how do you think this can improve? The second area is how can we continue delivering an integrated package of sexual and reproductive health services and rights, again, in your respective districts. So how can we really draw the linkages, and how can we connect the dots between the various programmatic interventions? Perhaps this is already happening, but how can we again ensure this happens more organically and more effectively? The third point I would like also to hear from all of you is, in line with the principle of leaving no one behind, how can we, through all these sets of interventions, programs and projects, really reach the most vulnerable and those left furthest behind, including, of course, but not limited to people with disabilities. So it will be really good to get your views and insights on these points while you reflect on your contributions. Thank you, and back to the MC.
Thank you very much for the guiding remarks.
Yeah, thank you very much, Master Moni. I would like to observe the protocol for the interest of time. I respect all of you in your various capacities. My name is Jimmy Ali. I'm representing the Chief Administrative Officer, Arua District. I would like to thank all the implementing partners who have been working together with us in the various districts. Participants, as they were presenting the status of implementation in the various districts, I presume we've been taking notes. And at this juncture, we are going to share our very experiences, district specific, and I urge us to share these experiences, as had already been mentioned, very, very frankly and sincerely, so that whatever we shall come up here is going to enhance on our implementation status in our various districts. There are a number of presentations. They gave us their progress, the challenges encountered, the lessons learned. Yeah, thank you. I've been informed that the other partner who is supposed to present is ready. We'd like to welcome them before we proceed with the preliminary session. Thank you.
Thank you so much. Protocol observed. Good afternoon, colleagues. I hope we are all well. By the name is Harriet Atieno. I work with Lutheran World Federation as a project officer SRH in LAMOSA program. I'm here to present on the behalf of LWF under the self-funded project with the support from Unfpa. Next slide, please. Yeah, that is how the presentation is going to look like. That is the background of LWF. It is a humanitarian and development arm of the Lutheran World Federation. We are widely recognized in international-based, faith-based organization working in over 20 countries. We seek to bring people of all backgrounds together in the common quest for just peace and reconciliation in an increasing complex and fragmented in the world. I'm not going to highlight on that, but that is our pragmatic framework, as you have seen. Next slide, please. I'm going to dwell so much onto this. The name of the project that we implement under LWF, it is maintaining critical life-saving and integrated SRH and GBV within Ugandan refugee response. What is the objective of the project? We are looking at provision of critical and life-saving integrated SRH and reproductive health and gender-based violence services with the particular focus on new refugee arrivals, and that is particularly on the receiving settlements. Our project started in January. It will be ending in December 2023. I think it was an oversight. It's 2023, not 2022. And we are implementing in the districts of Terego, Madiokolo, Isingiro, Chegegwa, and Lamo. We are geared towards two outputs. The first output that we are looking at is strengthened response capacity to provide quality life-saving SRH services. And then the second was increased rate of GBV reporting and service uptake within the settlements. Those are some of our key activities under the two outputs. We have integrated outreaches, and our coverage is, as you've seen. Then the settlement, we are in Unfpa, Rhino Camp, Nachivale, and then Chaka and Palabek settlement. And then we are also looking at orientation of VHTs on sexual reproductive health, including youth-friendly services and GBV, to ensure that the services are really provided up to the grassroots, still in the same location. Through the trained VHTs, we are also looking at the VHTs supporting us implement community dialogues within their areas. We are also looking at the coverage will remain the same, and then as I look at the interventions, then we are also looking at mapping out mothers and then linking them up. That is, those are the pregnant mothers to healthcare, especially ANC, and then institutional deliveries, because most of these mothers sometimes do not attend ANC and also tend to slide away for institutional delivery. Next slide, please. We are also supporting the provision of high-quality maternal health care, that is MOC, ANC, PNC, through the deployment of midwives in those settlements, establishment, and then running of the women's safe spaces. We are also looking at having training of the health workers on clinical management of rape. And then we are also looking at having the human resource that is under the psychosocial to support, provide comprehensive psychosocial services, especially to the new arrivals, as we all know that these people come with different kind of, they come with different kind of psychosocial issue because the other side have been displaced. So we are looking at making them stable as they are being settled. We are also looking at supporting the data capture with a focus on integration of national GBV database. That is, we are going to look at through the training of the health workers and then the data management, the information assistance, and then the biostats to ensure that data is captured well at the national database. We are also looking at production of IEC materials, including GBV referral pathways, in the women's safe spaces, in all those settlements, provision of integrated PCEA/GBV trainings to partners and agencies, including the border guards. As we are all aware that some of the stakeholders do not yet have the information, especially on PCEA, and they are exploiting the new arrivals, I would say, but also in the host community. We are looking at giving them information, but through the training, including the border guards. Because as the refugees coming into another country, they tend to be exploited by the border guards. But it is just because of the limited information. Next slide. Our progress so far, I'm not going to go into all of them, but I will give an overview just. We have so far conducted some integrated outreaches in all the settlements, totaling to that figure. We have also supported in a training of VHTs in all the settlements, totaling to the figures that you've seen, especially on SRH, family planning services. Through the trained VHTs, you can see so far they have conducted 28 community dialogues in their respective areas. Next slide. We have also supported in conducting the pregnancy mapping in Palabek, Chaka, and then Nachi Valley, reaching out to those mothers who have been linked already to care, especially those who had not received first ANC. They have been linked to care to start ANC. We have also trained 230 health workers and then VHTs on youth-friendly services to ensure that the services are delivered up to the grassroots. As we know that most of the youths are in the communities and in the rural settings, and we want to ensure that the services are really delivered using the VHTs and also the health workers. We have deployed 20 midwives. I couldn't break it down in all. Can I get some? I couldn't break it down in where the facilities where they are, but they are all in the other settlements, 20 of them. Next slide. We have 8 women's safe spaces that are operationalized. I'm going to leave the other one. The 20 volunteers have been trained to support the the functionality of the women's safe spaces, and so far they've also reached a number of people. And then we have trained 65 health workers on clinical management of rape, that is in Unfpa and Rhino Camp. Through the support of the psychosocial, we have deployed psychosocial assistants in the different health facilities. Next slide. Some of the lessons that we have learned, we have language barrier that is affecting the quality of services at the health facility, but also in the community, especially the refugee settlement. I would cite Palabek. We have diversity of languages. Integrated outreaches are mostly preferred by mothers in the community. Cultural beliefs remain a challenge in accessing SRH services among the new arrivals and then the host community. Distance to the facility affects the access in some host community and then the settlement. Men still do not embrace the use of family planning due to their myths and misconceptions, especially among the new arrivals. I think I will share the slides and then you will get the challenges and recommendations. Thank you.
Yeah, thank you very much, LWF, for that presentation. We are now going to resume our plenary session. I'll request the district leadership to raise issues and probably also make some recommendations so that our implementing partners can make responses towards that. At this point, the room is open for us to make our remarks. You are most welcome. Thank you.
Yeah, thank you. I'm Samuel from Zombo, the district CDO. One, I want to thank NPC and the UNFPA for bringing district leadership here to get a feel of how program implementation is going on. I am sure some of these partners are not very new in our districts. They're doing activities that they are presenting to us here. However, I have the following observations. One, how I wish these presentations were made in the district to the key stakeholders. Because, you know, if I come to learn about what takes place in Zombo from Gulu, I think that is not correct. We should be, because there are quite a number of other stakeholders behind. We are members of the district executive committee who are interested in knowing what these implementing partners are doing. Inception, some of them have not gone back to tell districts what they are doing. So I think there should be regular review meetings with the key stakeholders at district level to update us on the progress of activities. I think this is not going on, especially in my district, and I think Plan International you are following, you will no doubt that. And then two, the issue of monitoring, particularly the district level monitoring. I saw very well, and somewhere I think it was mentioned, that we should be involved in following, in monitoring, in providing supervision to activities that take place. I think we are at the mercy of the implementing partners. And I think this monitoring and supervision is legally provided for, even in the NGO Act of 2016, that the District NGO Monitoring Committee should be able to provide oversight. So it is a regulatory function. It's not simply the program providing for this kind of supervision. I think this should be complied with. And I'm sure when we look at our MOUs, we have really provided this very adequately. But I think we are failing to deliver on this. And then finally is the issue of reporting. These reports are not coming forth. One of the key provisions of the NGO Act 2016 is that NGOs will be providing regular reports to districts. And I think in my district, as a secretary to the NGO Monitoring Committee, every quarter we organize meetings and we invite all the partners operating to come. Unfortunately, some of these partners do not comply. And yet, the same law provides that we can take actions on them. So I think in this meeting, UNFPA, you should be able to see how you bring these implementing partners to order so that we are following this correctly. Thank you.
Thank you. That is from Zombo.
Thank you so much. I don't know if I've grabbed the mic or my hand was taken, but now that I have it, give me the permission. Thank you so much. I'm Simon Amandi, acting DHO Terego, and I want to thank the UNFPA and the for its engagement. Just like my friend has said, this is a good interface. I actually also want to confirm it's true. The IPs in Terego are doing a good job, and they're doing it together with the district leadership. Any activity they do, they reach through the DHO, who supports them to mobilize the facilities, whether in refugee settlements or in community. They do it in conjunction with the district leadership. I think I commend them for that. The picture which LWF, CARE, and the other partners have shared is true. However, the issue of presenting this in the district, I think it goes rightly that they need to improve on this so that we share on these indicators right at the district, not just for accessing funds. But of course, we have as refugees, we have 70-30% ratio. Our plight, our district plight is always that we need to move to 50-50. This has made actually few sub-counties which are hosting refugees are usually in a better performance in all other indicators than sub-counties where the refugees are not. Their performances are low. If you take one indicator, antenatal care, first timing, it may be better in refugee hosting places, sub-counties, than in other sub-counties where they're, because it's all about resources to do the work. So moving forward, I think a recommendation could be, because refugees came because of us, we also went to them because, so services will be tailored equally. The other thing is, I'm happy they're engaging VHTs, a number of trainings. This has become outcry. We would want VHT to facilitate, motivate our peer educators, our VHTs. Sometimes, when they do this training with VHTs for 5 days, for 6 days, they bring our VHTs who are not even sometimes paid to do this work, who are not motivated. But sometimes you see, they're allowed to come and sleep in a hotel like this, paid 230,000, 250,000 for 5 days. They are only given 40,000 to go back home. And this demotivates them to do actual work. I know money is not the first motivator, but it is also an access. So we would love to see if we can, sometimes adjust, depending on who. Like if a cow can be given his money to sleep in another place, maybe at 50,000, and he's given his 150. What about my VST who does not get salary? My mobilizer, my volunteer. You come and pack them in a good hotel like this, 5 days. Each day is about 200,000. 5 days is 1 million. If you give this money to this VST, that will be like his salary for the next 5 years.
I think that is noted. We are going to take 15 minutes to raise issues, another 15 minutes for responding by partners. Thank you.
Thank you. All protocol remain observed. I am Drangoli Santos, an economist from Obongi. I want to thank UNFPA, NPC, for the wonderful organization. And looking at where we had been and where we are moving, I know we are not moving to the high speed, but we are reaching where we intend to go. And I had no question on the issue of the IPF shared by Alan, because it was scientific and it was based on the situation in respective districts, and it was well echoed. My issues goes to the partners. We know, like in Obongi, the partners and the persons of concern are more than the host. We know UNFPA is putting a lot of money to give services for the refugees and the host community. The unfortunate thing is sharing this investment. Like today I saw the IPA for Bonn is around $223, and when you multiply that by just 3,600, we are talking about 800 million, over 800 million in 1 year. So, getting this investment from the partner is a challenge because they don't report. When you ask them how much they have invested, they cannot tell you. I don't know whether it was any arrangement, and this make us as planners not to capture your interventions. We are just doing mid-term review. I know some people might have done a sharing of the draft report. For Bongo, we are supposed to share early May, where we are going to have an engagement meeting with the stakeholders that will facilitate the final submission to National Planning Authority. These big investments are not captured. That is my biggest problem. Mr. Allen has given us IPF, but these partners, when they were presenting their work plan, the work plans were without cost. Now, as a planner, how do you evaluate whether this has been delivered or not? You know, these are off budget, we know. We don't need the money. We want to know how much you are investing and where. Like even IRCU, it is just say sub-counties. Which sub-counties? Like Obongi has 6. Are you going to work in the 6 lower local government, or you have a specific locations? So when we are sharing information, let's condense it so that we get better outcome and we're able to measure whatever we do. Thank you very much.
Thank you. Let us go straight to the point so that many more people can share with us.
I'm here, sir. Can I speak? Thank you, sir. I have 2 issues. The first issue is on the resource allocation. I have seen the indicative planning figures. That was, okay, I'm Richard Bongomin, the district planner, Agago. I have seen these resources that have been allocated on regional level. Actually region, West Nile region, all this. But to the best of my knowledge, resources are always located based on some factors. For example, poverty rate. We allocate resources to address the poverty index based on the region. We know very well that the recent report from UBOS has provided the report that northern Uganda has the highest poverty level. That is at 57.7, 58%. West Nile is about 19.2. Now I'm wondering why West Nile has been given $3.5 million when that money should have been allocated to northern Uganda instead of West Nile. So now, do we consider factors in allocating these resources, or we just come by guesswork? 2, my second issue, I have been following the presentation of the IPs. You know, government priority at the moment, Chair, is about Paris development model. That is priority of government. I have not seen linkage of these outputs which were being presented by the IPs to address issues to do with Paris development model. I have not seen even one. Me, I would recommend, strongly even recommend that these millions of dollars, if this UNFPA could consider, they sending them direct to the district. I'm telling you, within 1 year, you will see the impact of these millions of dollars. Other than challenging them through the partners. The partners have got issues with us, Chairman. When we invite them for budget conference, You find all the CBOs who are coming. The real partners do not come. The real one, they are presenting today. I'm just seeing for the first time. But when we call them for engagement, district engagement, they don't come. They don't display their indicative plan figure for us to appreciate and know what they are doing in the district. Now they are moving at all these millions of dollars. We recommend strongly, sir, let this money be channeled to the district so that we implement the real implementation, not this one which is consumable. Thank you.
Thank you. IPs, I hope you've heard. Those are serious ones. Thank you.
Thank you very much for this presentation. Members are giving in. My name is Tom Okello for DHO 2K. I have around 2 observations, the partners. I think at the end of this, they will be in position to go back and change. I also want to blame donors who sometimes give fund and then they don't follow it up. We have issues with the partners coming to districts, and then there's a government structure which is placed in the districts. But once the partner comes for an incept, that is actually the last. There are people they can get, like in my district, not partners who are here. They even begin calling meetings on the phone and say we're having a meeting in such a day. So the structures is one of the major things I want to bring to the attention of the partners, because they don't use them. Sometimes they begin telling us that, you see, we have a donor policy, we have this and this, we cannot handle all this. Then you find that issues remain just there. The other thing is that the issue of maybe facilitating maybe officers who are doing it. Just like the way they are presented here, IPs are good in presentations you have seen. They are very excellent. But putting it on the ground, that's what they even do with their funders even once they come. So you find that even in facilitation, this issue of mobile money has cost issues. I don't know which partners use it. We have got partners who have even brought activities in the districts, and then they pay you mobile money. We have seen them even closing the project with the people's facilitation and they go away. So that thing has to be addressed. You find a partner saying we have around 3 billion. But now, once we always ask that you have given us activity, were you ready with the money or what? Mobile money goes for 1 or 2 months. Then you imagine whether the partner was ready or not. When you begin asking as a district, they say, the policy, five people have to approve, 1 went to USA, so maybe when it comes back, you'll be approving. So there are issues around which we can. So some of these donors who give funds should also follow the money, because I have seen partners when a funder now is coming to follow the activities, what they have been implementing. They arrange people in the district, just arranging so that they have a welcome speech where the funder will come maybe and appreciate. So those things have happened, because if you are dearly transparent and you are doing everything, so you find that you don't need to arrange a team at the district who will interact with your funder. So those are the loopholes the funders have to, the IPs have to do what? Have to handle. Otherwise, there are issues with the IPs. I don't know, funders have policies which I think maybe they don't rhyme with the Ugandan policies.
Thank you. That is your 2K. Planner Omoro.
Thank you, sir. Thank you, Chair. All protocols observed. I'm giving an information that Uganda as a country, we are now doing budget online. We are doing budget online, Workplan, and so many things online. And the purpose of doing that is to ease monitoring. At the moment, the online practice that we have experienced is showing that you will see your other districts submitting reports. Then when you are not submitting, it wakes you up. But in the online process of planning, we are being guided by the 5-year development plan. The National Population Council worked so hard to ensure that the 5-year development plan for districts have integrated all the population activity, demographic data, We even looked into the demographic dividend. We did a lot. And now, when a very good program like from UNFPA, you know UNFPA, when it piloted, I was in Arua, we actually got the benefit by that time. And under planning, they gave us harmonized database, which died in the middle. But I'm not for that. I'm here now saying, if implementing partners are not doing their part, are the works that they are doing, are they in our budgets? Are they in our work plans? The information I want to pass here is that the work plan online is sketchy. I'm requesting kindly National Population Council, Ministry of Finance, and the National Planning Authority, including the ITs, to sit down to ensure that these work plans are properly made online, because we are not given the chance to do it well. It's very sketchy. I could even present the one for Moro and other districts because I have access to all the workshop plans in the country. So I'm just requesting that that should be looked in. Then these issues of saying this district or this partner is doing what somewhere will be cut and it will be solved, because we also have off-budget support activities online. Thank you.
Thank you.
Thank you, Chair. Once again, my name is Festo Kidi, the district CDO.
After, can you take for us the mic the other
yes,
side?
Yes, I'll speak then and go with it that side. I want to appreciate the organizers of this meeting. I want to appreciate so much UNFPA for the support that you are giving to the district. Members, I have just one observation and one reminder of one of the action points that we reached at in the annual review meeting of 2021 in Mukono Collins Hotel, which has never been implemented. I'm disappointed kind of that I'm not seeing the IPs that operating per day invited here, except Bragg that is here, but the rest are not here. I wanted to see the kind of report that they're presenting that goes to UNFPA. Members, I remember last time we had agreed that before submitting the report to UNFPA, it should first be presented at a district level, discussed, and somebody like Kau should sign the report to really know that what goes to UNFPA is not a lie, are not lies, but really a real report which is on the ground. Unfortunately, this has never been implemented. Can it still be carried forward as a recommendation that should go from this meeting? Members, in the last meeting, the last annual review meeting, we have proposed that IPs should be based with the local government for ease of access. There are some that stays very far away. Somebody calls you that, I'm living West Nile, I'm living Koboko. Can you mobilize me 3, 4, maybe 20 youth? I meet them on my way back to Kampala. I really wanted the kind of implementation that one is. This is an area of concern that I really want this meeting to take it seriously, and a position should be reached. Thank you so much. Let me go with the mic.
We are left with 5 minutes only. 5 minutes to raise issues.
Thank you so much. Rashid Khalil Azabo is my name, the planner Yombe. I want to thank my IPs who have presented here. They have presented realities, and my only concerns are these. One, on paper, we tend to talk more of integration, but this integration is very thin on the ground. We talk about it, but when it comes to execution of our plans, it is forgotten. I don't know what we are going to do with this. And the second bit is, this has already been raised, but my point in it is the definition of the host community it's becoming a thorn in the flesh in Yumbe. For now, if you take a trip traversing Yumbe from Kobo towards Moyo or Obongi, you'll think you're in 2 different districts. Because our partners tend to concentrate where refugees are. Yes, they are there. But we are no longer at a emergency. This is a development. But still, you find the host communities share. You know, these settlements are in a way that if it is a village, part of the village, there are host communities there. And part of them are the refugees. But many of the partners consider the members of the host community within that village or within that parish to have catered for the provision for the host community, which is very wrong. And this is skewing development in Yumbe district. And therefore, we will think, since we are talking of integrating our operations, our purpose of requesting for the work plans and the budgets from our IPs is to enable us at a budget desk level to see how much of these resources are coming from partners for similar activities in these areas, so that the little that we have can be used for other areas where these IPs are not operating. I want to therefore join my colleagues on the issue of IPs being silent on sharing their work plans and the resources that they are bringing to the district.
Thank you.
Could this be addressed?
Thank you. Is that the last one?
Thank you.
Another person. Our time is up for raising issues. We only need 2 people now.
Thank you so much,
2
colleagues.
people.
First, I want to, I'm Bakesima Patrick, District Planner Kamwenge. I want to appreciate the presentations and request that this be shared because the content therein has been so good. It can be used for learning purposes. And then secondly, local governments are finalizing the budgets. We are in the final budgeting process, and the budgets are due for approval before the end of May. And the requirement is that as we budget, we also capture off-budget support and on-budget support by the implementing partners. It has been talked about, but I want to emphasize that we need to capture the indicative planning figures that have been read to us here, even if they are either off-budget or direct budget support. In this case, like Kamwenge, since we expect 90,000 US dollar, this needs to be reflected in our budget before it is approved. Therefore, we need to get formal communication from the funder, probably through the line ministries, and you communicate to the line departments so that these figures are part and parcel of our budgets.
Thank you.
Thank
That
you
is
so
still
much.
integration of work plan with the district budget.
Thank you, the chairperson, for this session. I join the rest of the team to appreciate UNFPA for their continued technical and financial assistance to the government of Uganda and the lower local governments, more especially of recent through the various implementing partners. We also want to thank National Population Council for the leadership and for coordinating this in an orderly manner. I rise to, first of all, my name is Lulu Henry Leko. I'm the Assistant District Health Officer, Maternal and Child Health. I want us to look at what we have received at another angle. In the health sector.
Which district? Adjumani?
Adjumani.
Okay.
I am from Adjumani. I like what the UNFPA representative brought out, that the overall focus is by 2030, there should be 0 sexual gender-based violence. There should be 0 avoidable cause of maternal and perinatal death, and also 0 unmet need for family planning. When you look at what is presented in the indicators that have come out, they are more of to see these various big figures that I presented in terms of output to be translated into data in the DHIS2 in terms of uptake of family planning, in terms of reduction in maternal and perinatal death, in terms of facility level delivery, and that is what we are tracking. And so what does that mean? We need in this meeting to look at that connection between VSLA and access to, for example, antenatal services. How does that come out? And I think UNFPA needs to go ahead and do additional capacity building for DCSO so that they focus on result-based intervention. The focus will be at the outcome and impact level if we are to be able to do this very well. I think that needs to be looked at critically. Thank you.
The hand, the last one now. There is a gentleman with the red jacket. Down, down. Should that be the last one? I think so.
Thank you, Chair, for noticing our hands this side. I'm called Paul Bishop Deleba. I work for Arua District Local Government as the acting district health officer. I have two issues. I thank the presentations made here. I have an issue. One is that in all this, we seem not to see anything talked about infrastructure. I want to give you the assurance here that even if you teach people how to wash their hands so that they don't get infected, without a toilet, it will continue. The reds we are seeing here, we should not think that it's only the software that will address it. We want to see some component of infrastructure. So I would recommend here that some slight assessment be done to assess the infrastructure support towards the achievement of what we are dreaming. That I would be happy, and Arua District should be one of them as one beneficiary. Number two is the aspect of, someone alluded to that, who is a refugee hosting district. We see this here that when after all this ceremony is done, when we reach down, our partner tell us that you are not a refugee hosting. So in what Alan presented, we want to see the devil in the detail. What is it that, so that we can also commensurately provide our energy towards that. It's so bad to be disappointed at the end, to be told that you are now not a refugee hosting. We appreciate some of our partners whom we've worked with before, like CARE, and that goes to recommend that some of these partners you give to implement such projects, you let them have credibility. Let them have their own resources somewhere to support some of the gaps that are unique in the district, instead of asking UNFPA for additional funds. Mentioning CARE in particular for their GAC activities. So we'll be happy that the partners you give us should also be lauded partners. They should not be mediocre. So the last one is the aspect of refugee hosting. I would be happy whether Arua fits that. Otherwise, Chair, you could be chairing this meeting for... I beg to stop there. Thank you.
Thank you. Let us allow partners to respond to this. There are a number of them. If time allows, we shall pick another round of remarks. PDM, this is our vehicle for economic transformation. Partners, take serious note of this. The district leaders are saying, please integrate in your activities. Yes, this is a time for partners to respond. Thank you.
Thank you, Chair. I'll try and respond to a few of the issues raised. And I think one of the issues that you raised is about the partners sharing their plans with the districts. One of the things that we've kind of done is within the plans we've got coordination meetings, and when we're talking about the coordination, usually we are just facilitating, and the districts take lead in supporting these coordination meetings. They invite the persons that are supposed to be attending. And what is level, we present these plans, we present our work plans, we present our budgets, and we also share, when you write the MOUs with the partners, we share with you also the budgets for those specific districts. Because at the level where we are reporting UNFPA, we are sharing maybe activities in 11 districts. So the easiest way that we can be able to share the plans for each district is at the coordination meetings, which happen at the districts. So we have tried to take into consideration that. Then also somebody talked about the layering of activities and how the interlinkages happen. And I think we have tried to do that for the districts where we are working, where we kind of work with the different departments, the CDO's offices, the DHO's offices. And what we do is literally we work with them. They are the ones that identify the areas that we implement, and depending on the package, the resources available, we are able to work and also seek for linkages for some within some of the programs that are in the districts. So what we have done, I'll give an example of Agago. They've been able to support about 16 of the VSLA groups in the with the PDM. And for us, that is a way to go. We've also had a Jumani, I think, that have reported this. We've had a Jumani, I think, Obongi, where they have specifically taken the lead in trying to support some of these VSLA groups, and these ones are riding on that, and there is growth. You can see that there is a lot of development along that. And then when we're talking about the refugee hosting districts, yes, almost all these districts relate with the refugees. But then depending on the resources available, then we see which ones we are going to prioritize to try and address some of the issues. And like Bishop mentions in Arua, for care, because there are some other programs that are running there, we link into some of those programs. So for the other districts also that we work in, we try and see how the linkages happen between the different programs that we run around those themes. So it is not only these resources that they may be available, but we also have other resources that we usually source for, and we are able to provide the package depending on what the gaps are in that district. So we try and see how we make these linkages. Thank you.
Thank you. Care International. They are already integrating PDM in activities. I hope other partners will also do the same thing.
Okay, thank you very much, the districts, for the points raised. I'm from Interreligious Council, and actually in my presentation, one of the limitations we had is engagement of us by many partners, especially the district. So also our limitation is the districts engaging us. However, we came up with district interfaith committees, and they've not really been functional, and it's because they've not really been engaged. So our request is the districts to engage us at that level. Thank you very much.
Okay. The next IP.
Thank you so much, colleagues, for raising this concern that as may need to deal with. I would love to respond to one or two things and also put my observations. One observation is that you look at the issues of coordinations in these 15 districts, it varies from one district to the others. They are not at the same level. You may find out that the issues raised in Yumbe would be different from issues affecting coordinations in Arua district. Now what I would want to recommend is that district leadership under the DCDO would love to organize a district-based meeting to directly affect the district at that level, and you invite a partner at that level to participate in that, so that we deal with the reality on the ground. Last year, one of the key elements that came in was how do we map the sustainability roadmap. In that, we integrated so many structures in terms of working with parish chief, in terms of working with more emphasis at community level and CDO to work with structures at the community level to integrate our outcomes output into parish development model, especially the patterns that are doing the demand creations, looking at the pillar of the mindset, which I want to believe that we are faring well in terms of that. When it comes to be specific, to respond to issue of Zombo that my brother brought in terms of recommendations for us participating in the meeting. Specifically for this year, maybe, that we had not yet taken up on the multi-sectoral coordination meetings, and Zombo district has organized their meeting for next week as a district, and COW. Just to inform the House that the trend has changed. In this arrangement, for us, for all districts, we only house the budget and we facilitate. But it's the district that initiate the meeting, it's the district that invite partners, district share, and they accountable and responsible for this activity. And for us, we only facilitate. And as a partner, we are also invited as to participate in that meeting. So I want to appreciate districts that have taken up on that, especially districts that have already conducted their multi-sectoral meeting. For instance, Madokolo district that recently we did, and also the district of Pakwach who are taking lead into issue around democratic dividends. But just to appreciate that, it's always good to speak our minds and issues that concern us. But you would probably wonder sometimes if you are leading the session, like for the activities, we are having the technical person from the district, from community doing training for VSLA, doing training for model parents, and we're having office of the DHO and the team leading in terms of outreaches in school and out of schools. And we're talking about coordination. So if we have that gap, I think it would be okay for us to find out what is it that is not happening well, and how do we probably deal with that at a district-based level if there are specific issues that need to be probably addressed. But also on issues of infrastructures, as organization as planned, in the district you'll find out that we don't have only one program. And some of the districts here are aware of that. We have other projects that are addressing some of the gaps. Like for instance, if you look at Madi, you look at Yumbe, you look at Jumani and Madokolo, there are also other projects that are dealing in schools, and they're looking at infrastructures. And also, this specific program is doing demand creation and linking this to other programs. Just to appreciate that recently, Plan Uganda looked at the analysis of the UP results for last year, and our reports indicate that a school for answer that are doing software perform better than schools who are doing hardwares. And for us, we appreciated this so much. And now, how do we integrate this? How are we working with other projects who are doing infrastructures, building toilets, classroom, supporting teachers to upgrade in school, and also mobilizing the young person and changing their mindset to improve on education indicators, which is very key. And as an organization, I think we have the dynamics to address some of that at the district level, but also with the district leadership. Over to you.
Thank you.
Thank you so much, everyone. Once again, I just want to come back with some kind of, from the district analysis. I think I would start by coordination. I think as LWF, we have always worked closely with the district leadership, that is with the office of the DHO, DCDO, to ensure that trainings that are conducted, and especially where we need a trainer who can be gotten within the district, we work with those offices to ensure that they identify for us suitable trainers. So I think for that, we do not work in isolation. And then the other is about the linkages of how do we work with the other programs. I would cite this one in Palabek, that is in Lamour, where we are working with a care group, that is the VSLA youth groups, whom we have so far supported with the MHM startup kit, that is on reusable pads making. What does that mean? We are trying to promote MHM through the use of the VSLA, the young girls. So it's, that is through other projects, but within LWF. So we are also trying to link this up with other partners. And then under infrastructure, I would also be glad to inform the House that in Lamont, through the other sister project in LWF, we were able to construct about 8 change rooms. However, one of our biggest challenges is on the mindset change. These change rooms are constructed, but I would cite an example of Akeli Kong. There is a change room, there is even an incinerator, but the girls are not embracing the use of the change room. So sometimes as we talk about these infrastructures, we still need a lot to do, especially on mindset change, and that also refers us to the construction of the latrines. I would cite that still within the settlement, where other sister projects are constructing, but of course as the refugees come in, they come in with their own culture. We have all different kind of cultures, and you find that the latrines are being constructed to support them, but they are not using it. So there is still need to do, especially on mindset change. One of the DHO talked about we are not looking at reduction of maternal death, but under the pregnancy mapping that we conduct under LWF in the SAF project, we are ensuring that high-risk mothers are identified, because when they share with you that the document, it tells you the zone and maybe the village where the mother is. So we link them up through the VHTs to ensure that they are referred to the facilities for better services. So I believe that we are trying to link up these services to the health facilities to ensure that there is reduction in maternal death. And then integration of integrated SRH outreaches. It is also supporting in a way that in most cases, some of these outreaches are taken far from in a distance places that where mothers or the population cannot easily access the health facility. And it has supported in identification of critical areas, especially those who are sick, for referrals and then linkages. I would cite an example of one time we had an outreach in Palabek, that was in Zone 5B, and we found a mother with 3 children. All the children were anemic. I'm happy to inform the House that these mothers were referred to the health facilities, and we followed her up, and the facility, that was Palabek Ogili, has really supported her greatly with the 3 children. Thank you so much.
Thank you. I think that by 2 we should be winding up. I want to remind partners about some 2 key issues: the issue of sharing resources among districts and sharing resources among refugees and the host communities. That does not come out very clearly. And also integrating resources with the district. That one has to be handled. Thank you. Thank you, the Deputy Country Director, UNFPA.
Okay, thank you very much, Chair. And I want to thank all the district officials for their questions and comments. I want to touch briefly on a number of points that came up. And I'll be brief, given I have to excuse myself and depart from the meeting. But let me start, first of all, just to maybe highlight a couple of broad points that could maybe help respond to some of the questions and the points raised. I think, first of all, it's important really to clarify what's our role, I think, as UNFPA. We, as UNFPA, we are not a funder. We do not have actually a huge amount of resources that we can give away to partners. The vast majority actually of resources that we have, these are resources that we mobilize from third parties, usually from bilateral donors, that we then avail to our implementing partners to help realize the objectives of the government of Uganda and UNFPA agreed country program. And those are dispersed usually using the annual work plan modality, as you all know. So what does that mean? It means, in effect, that as UNFPA, we have to balance between a number of things. So we have, of course, the national and subnational level priorities, which should continuously lead us or guide us. We have, of course, as I said, our overall and overarching objectives reflected in the CPD. And we also, of course, have, and let's not forget that, the priorities and preferences, if you want, of our bilateral donors. So what we try to do continuously is reach a balance that could satisfy, to the extent possible, all of these stakeholders. So it's a very delicate balancing act. Now, what we end up doing and what we end up contributing at the end will always be done to reflect our operation within an overall within a reality, let's put it this way, of constrained resources and also limited, of course, time. So it means that as UNFPA, we cannot commit to do everything, obviously. I hope that is very clear. We are here simply to complement the role and the resources that the government through the national budget and the supplementary budget is putting forward in support of its own national and subnational level priorities. So, of course, we'll not be able to do everything. I think there was a long list of things that we were requested. At the end of the day, we cannot really satisfy all of these demands. So henceforth, really the importance of us prioritizing effectively, pardon me, with all our stakeholders and national and subnational level partners. And this is really part of that, of course, exercise. The second thing, which I also spoke to earlier this morning, and I think we've discussed really at length, and every time I wish it doesn't come up again, because I always feel or think that I'm communicating clearly. Unfortunately, perhaps I'm not, and English is not my first language. We cannot, and I want to say it unequivocally, we cannot give money directly to districts, period. We cannot, because these entail very high transaction costs from our end. We said that in Entebbe last year, we said it the year before, I said it also this morning, and I'll keep repeating it, colleagues. I'm very sorry. I know it may disappoint you, there is no other way around it. We work through our central level and subnational level partners, whether it is central level ministries or NGOs, both national and international. We simply cannot be giving money to 56 districts. We cannot. It's not manageable. We are a relatively small organization. We cannot really track and monitor and have in place all these oversight mechanisms that will allow us really to disperse money directly to districts and yet manage all the risks and reassure our donors that we are in a capacity to really be able to take up the fiduciary responsibility of what that entails. We simply cannot. We cannot do that. So what we can do is ensure really that we're able to maximize the coordination mechanisms that are there, and also ensure that to the extent possible we're not duplicating or overlapping with any other partner. And I want to emphasize, this is not our role singularly. This is a two-way channel. We need the feedback from the districts for us to be able also to do our job effectively. And really, I don't think it's right to hear, for example, districts saying we are at the mercy of implementing partners. No, you are the district. You are in the driving seat. I think my friend and colleague from the NPC made clear what the policies, the decentralization policies and otherwise are saying. So you have to be in a position as a district really to mobilize all the partners on the ground and be able to clearly set the tone. Of course, within, and please remember, we have already an agreed program with the government of Uganda, which is the 9th country program. So within the confines of the program, we should be in a position really to do what's possible, as I said, to maximize coordination and reduce transaction costs and increase efficiencies. So what that means that we need the districts also to be much more proactive. Let's really not always pass the buck. Let's take responsibility and accountability. And I think from what I've heard actually today from the comments and feedback, there are districts who are saying things are working. And I took note of Terego, Adjumani, and others. So it's also, I think, our responsibility to learn from each other and see why are certain things working in one district and why they're not. I think as the representative of Plan said, we cannot replicate the realities in one district to another district, but we can learn. So I really want to highlight that. Now, just to try and maybe respond very, very quickly to some of the points made. I think I agree, of course, that again, we have to see how we can ensure effective monitoring and reporting. For me, if mechanisms are already there, then we should really take advantage of those mechanisms. And then the district really authorities should be in a position to convene all partners to maybe come and present. But again, keep in mind, as UNFPA, we cannot also subsidize and fund all these district level monitoring activities. So this should be really the responsibility of the district to do, because we simply don't have the money. And that's why we have decided as well to cluster these meetings into districts, bringing together a number of sub-regions. So I think that the comments that were made on the issues of definition between host communities and refugees are very, I think, important. And I would like to hear a bit more maybe from the UNFPA team on how we do this differentiation. But I think usually we are really guided by a formula that will allow us to respond optimally to the needs of both the host communities and the refugees. And again, depending sometimes on the funding source and the expectations of the particular donor, you'll find that the balance will tip possibly each time. So I think we can try and see how we can improve on that. And again, your feedback will be very helpful in that regard. There was a question about how to capture the funding coming from UNFPA and through the UNFPA programs and projects. So I want really to emphasize a point here. I think that the funding that is coming through UNFPA, there are two things. One, we have really to consider it as provisional, because things could change in the course of the year. The budget could increase, sometimes it could decrease. So I don't want also the district authorities to take these figures and then say, okay, these are figures that are cast in stone, and we need really to ensure that we have received all these funding till the last dollar and the last cent. Even in the work plans that we sign, including with our central level partners, we say that it's contingent on availability of funds, which are not always available or not dispersed for a variety of reasons. The second thing that we need to keep in mind is that we are working, unfortunately, in different planning cycles on any given year. As UNFPA, we operate on the calendar year running from January to December, while the government operates on a financial year that runs from July to June. So keep in mind that what we commit is for the calendar year. So that means that you cannot, for instance, consider that any amount that has been provisionally committed will be provided in the district's or the government's financial year. So we are working on misaligned cycles that, and again, unfortunately, go beyond our control. Yeah, so how do we ensure that reports are consulted? So again, as it stands, we are actually struggling with a lot of delays, including from our implementing partners, including from maybe other levels. So I have no interest in putting additional bureaucratic hurdles that will further delay our reporting. So I think the question that needs now to go back to the House and to the implementing partners, if we have to consult the district authorities on the reports submitted, how could this be done in a cost-neutral way? Not even cost-effective, I'm sorry, cost-neutral. So that means that without adding not even 1 day or 2 days, I think, as far as I'm concerned, I have no problem with the IPs going to the district authorities and consulting them on the reports or using available structures, but again, without adding any additional days on the reporting. So that really, as far as I'm concerned, I'm happy with that if it's feasible, and I'll really ask for our IPs to look at the most efficient and cost-neutral way to do that. Yeah, I think, and maybe that will be my last intervention. I think there was a very important intervention from Ajumani on how we shouldn't lose sight of the overall objectives. And indeed, I fully agree with that. And again, that's why we're here, and that's why we meet also towards the end of the year. We have very clear objectives that the government of Uganda has actually subscribed to, which are the 3 transformative results that I mentioned at the beginning that we need to reach by 2030. The 5-year country program that is agreed upon by the government of Uganda and coordinated, of course, by the NPC and UNFPA, they are meant really to take us to those objectives or those results by 2030. So we know where we want to be by 2030. We use the 5-year country program cycles, but then we need also to ensure that our planning on an annual basis is actually ensuring that we keep making progress and moving forward on these objectives. So our responsibility, essentially, our collective responsibility is to ensure that we properly vet the indicators, the outputs, the interventions, to ensure that there are the appropriate interventions to guarantee our progress on these objectives. So we shouldn't look at these annual set results in a vacuum. No, we have really to ensure that they really are enabling us to continue moving forward, as I said, on the country program objectives and the SDGs, the National Development Targets, as well as the ICPD results, the transformative results. It's essentially like the government saying we want to be a middle-income country by 2040, and to reach there, we have to ensure that the various national development plans are actually taking us in that direction. So we need really to be in a position to connect the dots and ensure that we continue moving that trajectory. So let me stop there. And again, thank you very much for all the rich and useful comments. And maybe before I conclude, let me just take the opportunity to wish all our Muslim brothers and sisters a happy Eid, because I believe the Eid will probably be on Friday. So let me just do that, since I'll have to excuse myself. And again, these are not only questions for us, but I'm sure the NPC also can really enrich the discussion, and our central also government ministries. Thank you.
Thank you very much. Let us appreciate Director for those responses. We have other compliments. Can you, Mike? Yeah.
Yeah, thank you, Chairperson, and thank you, Daniel Alemo, for that wonderful rejoinder to the issues raised by the district. And I also wish to thank the implementing partners for responding. Mine basically is to say, as the country program, we are in the 3rd year, and I recall somebody said there were issues that were raised in Mukono, and we are gradually addressing them. So I think step by step we are moving, and we can't have a drastic change overnight. We need to have incremental change. And as we implement, we learn. Now, some of the things that have been mentioned, we take it off. We need to go and synthesize, think over it, and then see how best we can implement. we note, of course, my key takeaways is the issue of budget. It's a challenge, even both at the central government level. We have a challenge. How do you disclose this support we get from UNFPA? And remember, aligning the calendar year and the financial year. So at NPC, what we have done is we normally capture a half. Yeah? We divide it's an indicative planning figure. You may realize, you may not. But the good thing is, if you have captured and you get more resources, still you can. The budget tool allows us to report. So I think we need to take that, and probably, Daniel, we need to see a way of communicating an indicative planning figure to the district so that the planning units can capture it. Of course, we already have the DD indicators and we do the annual DD assessment, so this should be a boost. Of course, the other challenge we have here is how best do we align our interventions to the PDM? And I think this is what we need all to challenge ourselves and see how best we can address that. Of particular interest to me is, and as I had mentioned in my opening remarks, we operate in a decentralized environment, and I'm imploring all of us to respect the decentralized structures. Let's use the decentralized structures in terms of our implementation. I think, John, maybe you would respond to and Deputy Rep, the issue of budget transparency. How do we access the budget? I know from the government side we have the budget portal. I can actually access any government budget and know what is happening and so on. So probably as a country program, we may need to think of a budget portal that would enhance our transparency, and in terms of also, you know, the planners can easily Google, or you access the portal and you outrightly know what is happening to you. On behalf of the National Population Council, we still pledge our commitment to coordinate the country program and to continuously improve the implementing environment for us to achieve our goals. Thank you.
Thank you. NPC planner Omoro raised an issue of work plan in the system, which is a bit sketchy. She was asking for how you can be able to improve. Director, safe journey. Yeah, I'll feel that you could respond to that, how you can be able to improve your work plan in the online work plan in the system. Yes, doctor, you have issues to respond to.
Okay, no, I was consulting if the meeting had come to a close, because now when the two principals have spoken, but I wanted to speak to a few things that I think the Deputy Rep and the Director, M&E, have already actually touched on, but maybe to provide a supplement on about three things. The first was the issue of resource allocation. How do we identify the districts where we go to, the interventions? But I think the Deputy Rep already alluded to it, and I think we have ever tried to explain this before. The main criterion is normally what we call, I think it's called a deprivation index, that looks at the different SRH indicators, and normally UBOS would make a computation in terms of the performance along those indicators and come up with an index that gives where each district lies. And then they rank order from the worst to the best. So depending on the package of funding, then we see which are the priority districts to fit. And this is why these maps, wherever you go, most of these many donors and funders, you find they seem to be going to the same areas because of that. But also within this index, when you start unpacking it, you find some regions are worse off in some sets of indicators than others. If you looked at the presentation that was given by Alan, you would see that in West Nile, it was the priority areas was more of access to sexual reproductive health, and GBV was coming second. In other areas, GBV was coming first, and then access to SRH was coming second. And I remember when we were developing a joint program on GBV, I met some stakeholders from West Nile who were saying, how come you are not prioritizing us? And I said, it means you are not worse off when it comes to GBV than other areas. So we try to use that to map out the priority areas. Of course, now it depends on the package of funding. When it is small, the additional money, you are saying which indicators should we prioritize. There are some other considerations, especially when you are dealing with a joint program where you are coming in as UN-wide. You might be wanting to go to Karamoja, but say, let's go to some other place. Yeah, but that is the main criterion. Some results-based minded person was saying, but we are seeing only activities. How can we be sure that these activities are linked to those transformative results of moving towards zero maternal death, zero GBV, zero unmet need of family planning? They are not seeing results. And I agree. I agree. I think that's a very important observation. And again, maybe to remind our partners is that when we sign a memorandum of understanding, it is not about the activities. This is why we do annual reviews, we do biannual reviews, whereby activities can change. So what we are trying to purchase are results. So if you look at every implementing partner work plan, first we begin by results. What do we expect to achieve from you? And so also when we receive reports, we are saying, are we making progress in terms of these results? So each of these activities they are presenting here is linked to some indicator. Now those indicators, they are supposed to tell us whether we are making progress towards our contributions to reducing maternal death, unmet need of family planning, reducing GBV. Of course, the vision for UNFPA is that we can tell if we are moving towards this transformative agenda if every pregnancy is wanted. So therefore, what do we do together if we want to make sure every pregnancy is wanted, such that there's no teenage pregnancy, there's no early child marriage? So how do we prevent that? So we need to, on these things we do on the supply side, maybe providing supplies, and then on the demand side, encouraging use of those things. So those activities are basically around those. And then we say which partner is going to be responsible for this, and therefore what milestones can we use for seeing that we are making progress. So if we want every childbirth to be safe, what should we invest in? And therefore, how can we be sure that we are making progress? So which partner is going to do that? If we want to make sure every young child's potential is fulfilled, empowerment, what do we do? So there is a theory of change there. And so the accountability is around results. It's not about activities. So I agree with you that that needs to be demonstrated. Now, there are 3 levels of accountability. One is monitoring whether these activities are being implemented as planned. So that is the work plan progress. Then the next thing is work plan progress and those milestones. Now, it's true that our reporting system bypasses many of our partners who are supposed to hold people accountable. And actually, as we speak, and again, this is coming from the recommendations from district, how much is each implementing partner is contributing, and we hope that will help improve on our accountability at the district level. And then, of course, the other one is now at the level of the results. Some of these results, when we do annual review, that's when we present and say, okay, we have done ABCD, and this is where we end. So through the annual reviews, that's when we can provide that accountability. Many of them require surveys. So for this kind of meetings, we cannot. But the assumption is that for us to achieve that, the activities first be implemented. And this is why the accountability at the district level is very critical. So I don't know whether Ivan is around. If you can, one of the tools that we have been using, and I think we use it a lot, the district stakeholders who are here are supposed to have this tool, and normally we do share these tools. And so when we go for district-based meeting, so that's the tool that we use for tracking implementation of these district packages. Ivan, can you present that? So we have been going through district packages, but there are so many different things you cannot remember. You cannot remember all of these. So all of you are going to have access to what we a consolidated district package, which summarizes all the implementing partners in your district and the package of interventions and which quarter they're supposed to be implementing. And the way we track this, other than the quarterly reports, as one of the mechanisms is conducting joint monitoring at the district level. And I think we expect to plan joint monitoring, district-led, the stakeholder, where following maybe the reports, we go and visit. Then we have we call it coordination and accountability, where we give account on whether or not activities have been implemented, and then if not, why, come up with recommendations, so that this kind of discussions can happen. It is again, but anyway, so if you click on, you can just pick a sheet representing your district, and then you will see all the implementing partners there, plus the package of interventions and when they expect. The estimated or the indicative resources are all there. And so this is a tool that we expect the COW, the district community development officer, the planners, the DEOs, they should be having. And so you can always access and perhaps can be a basis for your discussion with the implementing partners. I think maybe that's really, yeah. So again, we have our field officers are there. They're also conducting routine monitoring. So we do not necessarily need to organize big meetings. We can have routine monitoring going on in partnership with UNFPA through field officers who are also in the district. So that's the supplement I wanted to make. Thank you.
Thank you very much, Doctor, for those supplements. I think he has responded very well to supplement on what the Director gave us. There are some issues also here. Somebody has wrote, as a district stakeholder, let us also look at where we could have not done enough to support implementing partners. The second, partners should give help to health workers. Partners should give health workers additional financial appreciation because they help these refugees during emergency management. IP should understand the flow of service delivery systems so that they can be effective. The other one here, this one needs a handwriting expert to interpret. I've failed. Thank you very much, UNFPA and partners, for those responses. I think we have captured a number of issues. I don't think there is anyone who is not satisfied here. As districts, we have the mandate. We have NGO monitoring board in all the districts. So it is our mandate to monitor activities of these implementing partners so that they are doing the right things. We have agreed here that partners should be able to communicate IPFs to the districts so that it can be integrated in the work plan. We shall be able to conduct joint monitoring of activities and also develop a system where we can access reports from partners. These are some of the issues which are very clear to us, which can be able to help us understand how we can be able to move on with our implementation and coordination at district level. I think I've come to the end of my mandate. I want to thank the organizers of this meeting for giving me this rare opportunity to chair this plenary session. Thank you very much, participants, for your active participation. Let us go back and appreciate the work being done by partners so that we can move our districts to another level. Thank you very much. I say all this for God and my country.
Our chairperson for the session, we really appreciate. It has been quite a very interactive session and full of vigor and a lot of power. Thank you very much, our dear participants, for that very comprehensive discussion. We are requesting that in case you still have an issue, you can write it on paper and make sure you hand it over to the Secretariat. All your issues will be noted down and will be factored in as we get recommendations for and an action plan for this meeting. Then also just a reminder to the planners that please make sure you submit those assessment forms to the registration desk for further. Without any more additions, according to our agenda of the meeting, we are requesting our director to come and, from the National Population Council, the director M&E, Mr. Samuel Omwa, to come and give his closing remarks and give us a way forward. Thank you very much.
Yeah, thank you, Joshua. Let's give a round of applause to our MC and also to the previous chairperson. I think he ably chaired the session and captured the key issues that emerged from our discussion. I don't have much to say, but suffice me to first of all, thank all of you in your various capacities. In a special way, I thank our ministry partners, Ministry of Health, Ministry of Education, and Ministry of Gender. In a special way also, I would like to thank our implementing partners. You give us that bridge between the center and the local government. And if you looked at the map there, I think you have that sub-regional outlook, which adds value to our interventions. And then the district, of course, the district local governments. We have had the issues raised here. The deputy rep has responded to some. Some of them we shall need to engage more in terms of what we need to do. The bottom line is we want to seamlessly implement the county program so that we realize those 3 transformative goals. As we agreed in the previous or the last annual review, one of the agreed action was to undertake this kind of dissemination meeting, which we shall take forward. We had also agreed that we should be able to do mid-term review, or we should be able to undertake joint monitoring. I think with our team at NPC, we shall be going back and then trying to design a program where we can do the joint monitoring and accountability for our intervention. It will be, as the name sounds, it will be joint. That means we shall have our partners from the ministries, we shall have you at the district, and then the implementing partners. I think that would allow us a much more deep delve into the nitty-gritty of what we are doing, and probably will generate more information and issues that we can take on to improve our implementation and programming. I don't have much to say, but again, once again, to thank all of you for the time you have spent with us and the valuable contribution you have given us to implement the country program. With these few remarks, I would like to take this singular honor and declare this workshop closed. But for our distinguished planners, we still have a small business we need to discuss you after the lunch. Enjoy your, thank you.
Thank you very much, our dear beloved director, for that very good closing remarks. Now, a little bit of issues on administrative announcements. As indicated in the letters, for the district participants, you will be facilitated with per diem and fuel refund, as indicated in the email. We shall be providing per diem for, as you know, according to district structures, for the cow, he will be having his own fuel refund plus a driver, and then the technical staff, we shall be moving as indicated in the communication we had. Now, we are not giving cash, but we are requesting that you give us your right account details to make sure that we effect the payment at once. In case there are any errors, we would have to do a back and forth. I believe all of you have submitted your right account details. There are a few names here that we have indicated that you need to go and clarify on your account details. There is Mr. Okello James P. Then there is Achero Jacqueline Pasca, I think that was the name written. And then William from Gulu, and then Santos. The other names were not clearly written, so we please plead that you go back and rewrite the names well so that we don't get any bounces. You know, when it bounces, you'll take a week or two. It is a back and forth, back and forth. Otherwise, we really appreciate the comments given, and we promise to improve in our coordination and implementation. Thank you very much for honoring our invitation, and have a good time. Thank you. Yes, lunch, as you go to the reception where you registered from, you'll be picking a coupon. Someone asked me about our Muslim friends who are still fasting. There is an option of also packing your lunch at the restaurant. I think we are clear. Our dear planners, we request that we have a session for those who have not clearly understood the assessment tool. Please, let's have a session, because this assessment tool will benefit us as the planning department for strengthening our data and coordination section. Thank you very much. Have a nice day. Thank you very much.